people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
我们能够做到.
Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
In this session, and by getting
and
vaccinated.
I'd like to invite the clerk to conduct the roll call.
Supervisor McGorty?
Here.
Supervisor Mulhern?
Here.
Supervisor Hashak?
Here.
Chair Jurdy?
Here.
Supervisor Williams?
Here.
Okay, well, I'd like to invite Supervisor Hashak to lead us in the Pledge of Allegiance.
I pledge allegiance to the flag of the United
States
of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you. Next on our agenda is public expression. Members of the public who've submitted an online comment, please enter in now, join the meeting now. And you can comment on items that are not on today's agenda or on the consent calendar or on the closed session items. Do we have any members of the public wishing to comment on any of those items?
Yes, we do. And the first on the line will be Beth Pine.
Hello, good morning. Thank you for allowing me to speak once again. And today I wanted to bring to your attention, I live at 15055 Mitchell Creek Drive. My next door neighbor is 15183 Mitchell Creek Drive. And the reason I'm bringing this to you on comments on non-agenda items is because I have spoken to the code enforcement for your cannabis program, and this neighbor of mine is growing and has been for years growing a very large amount of cannabis. And speaking to code enforcement, he is under the cannabis program for Mendocino County. Prior to him being in the cannabis program, he has been raided and has had his plants eradicated at least twice, and has never followed any guidelines and continues to not follow the regulations set forth by Mendocino County. I get the idea from code enforcement that they will try to work with him to get in compliance, but I can tell you that the neighborhood has repeatedly said they do not want this industry in our neighborhood. And so I am bringing this to your attention because I know for myself and for many around here that we would really like to see this man not get a continued approval to be in your program. He has never followed the guidelines associated with growing cannabis in this county. He doesn't show any indication of following the guidelines set forth in Mendocino's cannabis program, nor the state program. And so I didn't feel like I was going to get a very positive or satisfactory response from code enforcement around this issue. And so I very much wanted to bring it to the Board of Supervisors' attention that that we're over here on the coast, we're kind of out of the 101 corridor and out of the view of many of the cannabis growers. We're not the most, we're not the biggest, this isn't the biggest priority, but for our neighborhood, This has been a priority for many years. We really do not want an industry. We moved here to get out of industrialized area, and this person has been trying to put an industry here in our neighborhood for a very long time. And I thank you so much for your attention to this matter.
Next on the line will be Katrina Bartlemy. Katrina, you're muted.
Sorry. This is Katrina Bartlemy, Assessor, County Clerk Recorder. I would like to give you a quick report on the cannabis referendum for the full repeal of the entire ordinance. So we finished checking signatures and verifying and double checking, and Friday afternoon, actually. So out of 6,239 signatures that were turned in, we verified 4,198 to receive the qualifying amount of 3397 signatures. So it's on the agenda for September 14th. So I know that, it will be a big discussion point, but I just wanted to give everyone a heads up that there were enough signatures to give it back to the Board of Supervisors for their response.
Okay, thank you, Katrina, for the update.
Sure, you're welcome. Thank you. Have a good day.
And that concludes public comment.
Okay. Next, we have the consent calendar. Are there any items on the consent calendar that board members would like to pull for discussion? Supervisor Mulhern.
Thank you, Mr. Chair. I don't need to pull the item. It's item 4G, and I would just like to request that the Board of Supervisors receives the quarterly updates along with the Measure B committee.
Okay, thanks. Supervisor McGordy.
Also on 4G, I just wanted to note that my wife is very involved with NAMI. So even though I may vote on this, I just wanted to disclose that she is a volunteer member of NAMI, and I just wanted to be sure everybody understands that. She receives no compensation.
Okay, thank you. Any other comments on the consent calendar? Okay, would someone like to make a motion?
Move approval of consent calendar.
Second.
Okay, we've got a motion and a second. Can we have a roll call?
Supervisor McGordy?
Yes.
Supervisor Hashak?
Yes.
Chair Jurdy?
Yes.
Supervisor Williams?
Yes.
And Supervisor Mulhern?
Yes.
Motion carries unanimously.
Okay, next we have the public health update on COVID-19.
Thank you. Chair Jurdy, members of the board, and CEO Angelo. The data is mixed this week. The case data seems to have slowed down this week, but reporting issues have also been noted at the state level, so it may be somewhat of an artifact. Could I have the first slide? This shows, and I'm not seeing it yet, but we'll get it up there. The Mendocino cases average is 52.5 per 100,000 per day. This is a 7-day lag, and has come down from 59.6 last week, but just for 1 week. Do we have that slide coming up? Let me see.
Dr. Corn, this is Atlas Pearson, Deputy Clerk of the Board. Who is going to be running your presentation for you?
Kirk Ford. I think he was
Okay,
sent an
one moment.
invitation.
And Dr. Corn, if there's a slide, if that could be sent to the clerk for upload to the website as well as distributed to the board members, that'd be great.
Kirk, could you put on the first slide? And Chair Jurdy has also asked that that the slides actually be copied and sent to the members of the board. So this shows, yeah, thank you. So the first slide shows the sort of a plateau and even possibly a downswing in the last week. Again, this is a time when it may be an artifact of problematic reporting at the state level. And so I want to be cautiously optimistic. I'd love to see this number be decreasing, but I'm not entirely sure. And when I look on the state site, the test positivity for us is actually higher at 9.5%. But again, with low testing, this may not be a reliable number. On the other hand, hospitalization rates are still very high. And this is probably a better indicator of how high the transmissibility has been. Remember, hospitalizations follow the case rates in the community. On this slide, you'll see again in red the numbers of people that have been hospitalized. And in blue are the numbers of intensive care unit hospitalizations. And in both these cases, they're clearly greater than they were back in the large surge over the winter. We have yesterday had 30 Mendocino County residents in our hospital, and we have 5 of our citizens in higher levels of care in Santa Rosa and San Francisco in addition. We have had 3 that we're caring for from out of town. And we currently have 8 COVID patients in our intensive care units, with today having only 3 staffed ICU beds available, which is 18%. This number fluctuates pretty rapidly, but we've had several days in the last week or 2 with no ICU beds available. This is more than we have ever seen in the county in terms of COVID cases. And we are also seeing younger and sicker patients in the hospital and among those who've passed away. As I mentioned last week, Adventist Health Howard Memorial and Adventist Health Ukiah Valley has submitted formal notice to the state of their intensive care unit shortage and their use of alternate care locations within the hospital. So far, I have not been notified of any staff-patient ratio reductions, which is a measure of quality of care they are maintaining. The total cases at this time are 6,027 that we've had in Mendocino County, and among the Hispanic population, 2,470. The deaths have gone up significantly and now number 64, which is 6 more in the last week. Another notable is that in the last week, we had a 41-year-old pass away who had no comorbidities. So though the case numbers do not seem to be growing, the hospital and mortality rates are increasing. This could be a glitch in reporting, or we may be seeing hospital rates are following the cases, and it may level off, and that may level off in the next week or so, or we may still be in a rising tide of this surge. We continue to see many high-risk exposure events, and that's especially in restaurants and bars that contribute to community spread. In response, I'm preparing a new order to require employers in those businesses to adopt policies for employees to vaccinate, or if exempt, for medical or religious reasons, to show proof of testing. And for patrons, they will have to verify vaccination status if they wish to eat inside, or they may pick up food to go or eat outside. I believe this will protect the employees and the patrons without harming the small businesses or the community's access to food. This week, we've identified several outbreaks. In the jail, it currently involves 8 corrections officers and 15 inmates. Round Valley is having a very large outbreak, which the Round Valley Indian Health Center and Tribe manage with help from the county and the state. One business, a dispensary with 3 epi-linked cases, was identified as an outbreak, and we have 2 nursing homes, Sherwood Oaks and Redwood Cove Nursing Home, who have been identified with outbreaks that they are controlling. In the schools, we've had many cases identified with testing, and modified quarantine of close contacts appears to be controlling these with minimal time lost from the school. One school decided to close an entire class and provide independent study. But in general, we are not seeing increased transmission within the schools here in Mendocino County, and that has been confirmed as well out of the county. Contact investigation and contact tracing. The maximum daily new cases last week was 70. Some state staffing is being withdrawn, but new staff is being trained at this time. Testing continues at 5 days per week at the Ukiah Fairgrounds, and this is now augmented throughout the county with the addition of a traveling van from OptumServe. And this will increase the numbers of times in each of the smaller communities around the county. In addition, we have Nuestra Alianza testing 4 days this week in Willits, and Mendocino Coast Clinic is testing twice in Fort Bragg, in addition to their testing resources provided by the county. Again, this continues to be a severe pandemic of those who are unvaccinated, with unvaccinated cases numbering 7 to 1 of those vaccinated. And as far as hospitalizations and deaths, their unvaccinated rates are 10 times higher than those who are vaccinated. So how is vaccination going? We're now seeing a modest increase in vaccine demand, which parallels the state. We continue to offer vaccines at the Ukiah Fairgrounds Fine Arts Building every Friday, and we are working on a schedule to have regular weekly vaccine events at the Public Health in Willits and Fort Bragg. We are working and encouraging the clinics to collaborate with the local schools in preparation for the vaccines to be authorized for the 5 to 12-year-old children. And we continue to offer vaccine clinics around the county at events and upon request. The current distribution of vaccines as of August 23rd, no, it was actually August 30th, was 99,149 total doses. 73.5% of eligible people in Mendocino County have at least been partially vaccinated, and 65.5% are fully vaccinated. From an equity perspective, at least partially vaccinated are 83% of the quartile 1 population and 72% of the quartile 2. And in the Hispanic population, 62% have been at least partially vaccinated, compared to this 69% of the non-Hispanic white population. And this is a significant increase within our Hispanic community, and it is better than the numbers that are reflected statewide. As far as age groups go, our youngest from 12 to 18 are 47.5% at least partially vaccinated. 18 to 49 are 69% vaccinated. 50 to 64 are 86% vaccinated, and the 65 plus 79.5%. Please note that it's the 18 to 49-year-old at 69% that we're most concerned about, and really want to push the vaccine to this group. It is in that group that we've seen a significant increase in the numbers of cases and deaths as well. The third doses for immune-compromised people are proceeding at providers' offices and clinics. The boosters for those who've completed the series is due to start by September 20th, according to the federal government. There is discussion about this rollout with the California Secretary of Health, Dr. Gailey, this week. Those plans have not been finalized within California, and the approval for vaccines for 5 to 12-year-olds is expected in the next 1 or 2 months. So we expect a very busy fall season administering vaccines. As far as schools guidance, youth sports guidance has not formally been released from the CDPH. There have been a lot of delays. I wrote some guidance 2 weeks ago and then participated with the Bay Area health officers to draft a more comprehensive guideline, which includes some school activities, after school activities like drama and choir, which we will distribute later this week. In summary, we have been seeing increased hospitalizations, intensive care unit admissions, and these are stressing our hospital system. And now we're seeing a commensurate increase in deaths. This is affecting our younger and healthier people. Nearly all are unvaccinated. This is worse in the winter surge, worse than the winter surge. And since the vaccine has been fully authorized, I'm hoping that more will get vaccinated to protect them. But then ahead, there is still Labor Day weekend and other celebrations like Halloween, Thanksgiving, and Christmas, New Year's that could set off an even larger surge. So our focus now is on control of outbreaks, the schools, and providing more vaccines. And with that, I'll end my report and remain here for any questions.
Supervisor Williams.
Hey, Dr. Corin, in your view, is our county fair a good idea?
I think if people take precautions, and depending upon what the promotions and the admissions are done and the preparation within the fair, I think it can be a reasonable thing to do so we don't miss that from the county. We've had other large events in the last couple of months and they've gone off pretty well. So I'm hoping not to make sweeping changes in terms of events, but rather advise the venue operators about what they should be doing, and hopefully in time for them to get out to people who are invited so they come either vaccinated or with some proof of negative testing. But it is up to the venue operators at this point.
So what tends to happen when we have events, I imagine other supervisors get these calls, people asking, where's the enforcement? There were guidelines, the guidelines are not being followed. How do we handle that with the county fair? Where will those calls terminate and what will be done? Do we simply refer back to the Fair Association? I'd like to sort of be pretty proactive about it and have a plan in place. And if the answer is the county plays no part, we're not going to field those calls. It is what it is. Let's say that up front.
But we do not have the staff, nor do we have the legal authority to enforce those within the fairgrounds. The staff operators should have security there. They should encourage, certainly at the time of admission, they should have posted rules and so forth. And then it is also up to people who are working in the fairgrounds and even those who attend. We are trying and have been trying to teach the community the safest ways to live our lives. And it does require cooperating, but it also does require reporting to the authorities or the people who are respected inside. For example, if a mask is not being worn, they should be advised to wear a mask, but we can't enforce that.
Thank you. And last, I've seen email chains in our county in regards to the vaccine adverse event reporting system, which I believe may misinterpret some of the data. It looks like anybody can file a complaint. And today, if you were to look at that data, I think it might highlight potentially 16 people in Mendocino County have died as a result of COVID vaccination. I know that's not the case. I know the number is 0, but I think we do have some members of the public weighing the risk of COVID versus the risk of vaccine. Is there anything we can do to boost transparency, either of our records of how this vaccine adverse event reporting system works, what the truth is of the data, what the follow-up looks like? We're not going to convince everyone to get vaccinated, but I worry about people who are on the fence not having accurate information to rely on.
Well, that's a very good question. So it should be clear even from the name, it's a reporting system. And within California, there's an additional reporting system for vaccine adverse events. And these systems are incredible for identifying either symptoms or conditions that have occurred that might lead to vaccine as a cause. But the fact that it's being reported does not mean that there's a cause and effect relationship. So a person may have had a vaccine and may have then passed away even on the same day. The cause and effect is something that needs to be evaluated, and that is what the committees who get those reports are charged with doing. in our county, we have had no vaccine-related deaths. There was one person who was flown out and had a cardiac death, and that was shortly after a vaccine, but it was very clear it was not from the vaccine. It did not have any of the associated lab tests or other things. It was just an unfortunate coincidence in time. And other than that, there have been no associated vaccine deaths. The numbers of COVID deaths are clearly documented, and the numbers of COVID cases, unfortunately, that have long-term effects are not as well documented, but they reach into the hundreds and so forth as far as complications that may be long-term. So more than that, I don't know what we can do. We don't usually publish the VAERS data, but it might be something that we could do is to publish an explanation of how people can register their concerns, and their concerns and their experience with the vaccine should definitely be reported. Usually it's by their provider, but individuals can report their own through the California system, and they get investigated. So maybe we can put something like that on our website in terms of the vaccine. That might be very helpful. Thank you for the suggestion, Ted.
All right, Supervisor McGorty.
So the surge we're undergoing is actually quite a bit larger than the one we had last winter. Is that correct?
That is correct.
And do you think it's because of the Delta variant is so much more infectious that we're seeing that?
Yeah, absolutely. Because there are less people who are susceptible. There are many more people who are vaccinated, and the people who are actually getting the illness are, as I said, 7 times more likely to be unvaccinated. And it has to do with a tremendous increase in the contagiousness of the Delta variant. Now, the people who get it or carry it who have been vaccinated generally do not have a severe disease. So the vaccine remains very, very effective against severe disease, hospitalizations, intensive care units, and death. What the Delta is showing is that the mild disease and even asymptomatic carrier states are still in a greater number than they were with the prior variants. So we're seeing this huge surge.
And as follow-up care, people who've had COVID, do you generally recommend that they be vaccinated? Is that something that's a practice in our county?
Yes, they should be vaccinated. That's a frequent question that comes up. People are generally immune, felt to be for approximately 90 days after they've had the illness. And when the vaccines were scarce, we actually suggested that people hold off on vaccinating until that time had passed and their vulnerability increased again. We don't do that anymore now because we don't have a scarcity of the vaccines. And so a person right after they're finished with their isolation period could go out and get a vaccine. That would be perfectly legit and more protective.
Thank you.
All right, thank you. Supervisor Hashtag.
Thank you, Chair Jordy. So, Dr. Corn, we're still seeing a disparity between the Hispanic population and the population in general. And so, with the COVID rates, the vaccination rates, several of those factors, can you talk about what is being done ongoing to kind of combat that disparity?
Well, I believe you're all familiar with our contract with the Promotoris, which is operating in the Willits and northern area there, and we have other activities going on the coast through Mendocino Coast Clinic and Anderson Valley Clinic, who have a large number of Hispanic-speaking people, and they're actually phone calling neighborhoods and getting them in for their vaccines. We are putting a lot of social media and advertising educational work out that is bilingual, and I appear twice a week, once to twice a week on Spanish radio to also answer questions and inform the Hispanic population of what is going on. We have Nuestra Alianza is also offering not vaccine, but testing in Willits, as I said, 4 days this week. And we're trying to increase that outreach to more of the Hispanic population. And I think that there has been some improved uptake on the part of vaccines. If you see the numbers, while the non-Hispanic white population is still, I think it's 7 or 8 percentage points more vaccinated than the Hispanic population. That's better than it was at 9% more a few weeks ago, and it was significantly less over the last few months. So we're trying to do that, and I think that there is more information going out, and that's a big key is to make sure that there is more information. The other thing we're trying to do is target some of the agricultural workers and businesses around the county with offering vaccine pop-up events.
Okay, thank you.
All right, thank you. If you're through with your presentation, I want to go to just if we have any public comments on this item.
Sure.
There is no public comment for this item.
Okay, Supervisor Mulhern.
Thank you. I did want to make a clarifying statement that I think is very important for me to say. So I realize, Dr. Corrin, that you're the public health advisor. I just want to be clear that businesses should not be the public health police. And if you're choosing to move forward with this order, it should be made very clear to the businesses what their expectations are for verification and which businesses are affected. Our small businesses are specifically targeted because they are honest in trying to support public health and the economy. This does not take into account the large number of people that are not cooperating with contact tracing. And instead of placing this restriction on businesses, I think we should be encouraging testing and masking while indoors at restaurants and bars. And I realize that large cities have been able to implement this policy, but placing Mendocino County businesses in this position while surrounding counties have not adopted this policy puts our local residents and their businesses at risk of not being able to survive this roller coaster. I'm not in favor of deviating from CDPH and CDC guidelines. It creates confusion amongst the public. So I really just wanted to be very clear. I hope that we are able to support our businesses as much as possible through this. I understand your intentions. Thank you.
Okay, thank you. All right, well, we will go on to our next.
This is Atlas Pearson, Deputy Clerk of the Board. I do want to point out that we have Dr. Janine Miller from Behavioral Health and Recovery Services on the line, and she did have some information to provide for the update.
Okay, go ahead, Dr. Miller.
Good morning, Dr. Janine Miller. I just wanted to give a quick update on what's going regarding our transporting mental health clients out of the emergency rooms and to either the alternative care site or to a psychiatric hospital. As you know, we've been working on making sure that we can clear our emergency rooms as quickly as we can for individuals on a 5150 hold so that we can go ahead and care for those having a medical emergency or our COVID positive patients. So we did start transporting clients. The ambulance has first right of refusal. If they are not able to do the transport because it would impact the community or another transport, then Redwood Quality Management Company, Redwood Community Services, and the county are stepping up to handle those transports. And we have been doing those transports since August 16th. We will continue to do those transports through this surge and provide that additional support. We also did open the alternative care site out at the training center in Redwood Valley and have started to accept clients. We started accepting clients on August 23rd. We are staffing that with staff or on call 24/7 so that we are able to take individuals out of the emergency room, house them while they're waiting for acceptance at a psych facility, and then they're transported from that facility to the hospital. So I just wanted to give you guys a heads up on that we have started doing that. We will continue to do that through this surge and have both been transporting and accepting clients. Also working with Redwood Community Services to make sure we can either place at the alternative care site, get them accepted quickly, or also use our crisis respite that's in the Ukiah area. And so that's been going very well. So thank you.
Okay, Dr. Miller, see hand raised from Supervisor Heshak.
Thank you, Chair Jurdy. Yeah, I heard this report that Dr. Miller just gave at the Measure B committee meeting, and I really want to commend Dr. Miller and her team for getting this up and running so quickly. You know, we're in really crisis times with the hospitals, emergency rooms and everything. And for, you know, Dr. Miller and her staff to be able to get this these alternative care sites for these people, to be able to get them out of the emergency rooms is critically important. And so I really want to thank you.
Okay, well, thank you. Supervisor McGordy.
I had the privilege of visiting with Jan McGordy because she wanted to deliver cookies to the staff, and it's very comfortable what they've set up in Redwood Valley, and it makes so much sense for someone who's in a crisis to get out of an emergency room once they've had their overall medical check, because it's so much more peaceful. And what they've created in Redwood Valley on an emergency temporary basis looks really good.
Okay, well, thank you. And thank you, Dr. Miller and your team for setting that up. Anything else? Okay, all right, we will go on to item 6A, which is the Drought Task Force update. That's Supervisor Heshak and McGordy.
So, well, we're busy, and I see Josh Metz is on the line. I think I would like to turn it over to Josh, Supervisor Heshak, unless you have something you want to say right off the front.
Well, I just wanted to add that we have been really busy, and I think that we've got a really good team working that's looking for solutions. And I think that we're very close to getting something to happen. And I appreciate the work that everyone who's been working on this, you know, Josh Metz, Howard DeShield, Judy Morris, and you know, Supervisor McGordy. We've been doing a lot of work on it, and I think that we're going to get water to the coast. And so hopefully we'll have some actions today that will make that happen.
And also I want to thank County Council because they've been on top of it really well, making sure that we got our mutual aid agreements put together fairly quickly and efficiently and actually very readable. So hats off to the County Council crew for helping.
Okay, so Josh, would you like to take it from here?
Yeah, thank you, Chair and Supervisors. Good morning, Mendocino County. I have a slide deck that I'd like to run from my desk if I can here, and will help us kind of step through some items that the ad hoc committee has been wrestling with over the last few days since your emergency meeting last week. And I think will inform some of the discussions that you might have. And so let me see if I can do that here first. Okay, screen 2. Okay, can everyone see this cover sheet? Okay, so I'm going to talk about these items. I'm just initially we'll review the outline of the program that we put together, the water supply replacement project for the county, and then really run through a few policy considerations you might have in taking any further action on this, particularly related to the pricing, and conclude with some recommendations and open for discussion. So again, the water supply replacement project, primarily focused currently on the coast, provides for long hauling water from the city of Ukiah to Fort Bragg, treating the water at Fort Bragg, and then making that available for hauling to unincorporated parts of the county and the coast. There is potential state funding for health and human safety needs There aren't programs to meet commercial needs, so we've set up a mechanism to track domestic and commercial use. And the outlines of the program that you considered last week establish different pricing scales for the different use types. So that is where we kind of get into some of this, policy discussion, because the setting of this price is for you all to decide. So some of the outlines of what we have as estimated values for this cost model. There is a potential daily demand. Again, these are estimated values because there really is no actual record of use. And again, this is set up to be potentially scalable to other parts of the county. So there's a larger number, over 120,000 gallons. And for hauling, kind of the cost estimates that we have gathered up until now suggest that there'll be about a 27 cents per gallon cost to get water to Fort Bragg. So that's the important number, the 27 cents. Traditionally, folks on the coast would pay, if they were hauling water from Fort Bragg, they'd pay 3 cents a gallon for the water, and then they'd pay for the hauling cost of the trucking. So some of the issues I've kind of described already. There is a Department of Water Resources drought relief grant program that we're currently pursuing, working with the county team that may provide grant funds to support hauling for domestic uses. There is a state Division of Drinking Water Urgent Drinking Water Needs Program that may also provide grant relief for domestic use by low-income residents. So there could be some reimbursement for folks below 80% AMI under that program. Currently, there are no state or federal drought relief programs supporting commercial use of water. So really, it is up to local action to do anything around commercial use of the water. Just some notes on the transient occupancy tax question, because we have heard from the hoteliers on the coast that there is, significant concern about being able to continue to operate through the rest of the high season, which is right in front of us, representing about 20% of their annual TOT revenue. So about 20% of $4 million. And having had some specific discussion with lodging association members, most businesses have not historically needed to purchase external water. Most of them in normal to dry, not super drought years, could persist on their local wells and water supplies. So that said, for the coast, the best record indications that we have that there's about a 75,000 gallon per day demand on the coast. It could be higher this year. We don't know, and that demand would include domestic and commercial. So the policy consideration for you is around, the question of subsidizing hauling to the coast that could stabilize a projected TOT revenue versus some potential additional economic impact. A key point here is that actual demand is unknown. And so the idea is that we would begin hauling the water, seeing what the market yields in terms of demand, and then need to adjust potentially if there is more or less demand. So what I've done here is drawn up, this is kind of a colorful graph, but basically it's aimed at showing you sort of the option of, a county subsidy rate of 100%, like if the county was to take all of the long haul costs and pay for that directly, and all the 75,000 gallons were used for unreimbursable uses by the state, your daily exposure would be around $20,000. If you were to So this top line is all the water going to unreimbursable uses. Call that commercial use. This thicker green line is one that says half of the water, half of the 75,000 gallons was to go to commercial use, and the other half to domestic use. Then your county exposure would be about $10,000 a day. And the good news is John Hashak is such a quick mind with the numbers that I always can rely on him for great questions. And I see that he's raised your hand, Supervisor. So I'm happy to take a question midstream if you have a clarifying or question for me.
Well, thank you, Josh. So my understanding is that for the first month, we will not get reimbursed for residential or commercial use.
Correct.
So for the first month, we're paying 100% of whatever we subsidize.
That's correct. That's correct.
Okay. And then after that, if we do get reimbursement from the state for residential use, whether it's all of it or for the low income people, then that will affect this chart too. Okay,
Correct.
thank you.
Yes. I see the clerk of the board has their hand raised.
Morning, Chair Dirty. If I may, through you, this is Darcy Antle, Assistant CEO. I would like to point out that the current grant written with DWR, Department of Water Resources, does include the long haul for both private and commercial. That is the current. Now that we don't have approval on that, so that's after the 30 days and after we have approval. But that is what the current, how the current grant is written.
Correct. And so there are some, unknowns with these grant programs. The way that the DWR grant program is written, it doesn't discriminate as much between use types. The Urgent Drinking Water Needs Program has a much tighter definition of what's allowable. So these are the dynamics we have in terms of, pursuing these grant funds. But it is possible that indeed, as Darcy mentioned there, that there could be full cost recovery for the long hauling of water to the coast after it's approved. But I think your point, Supervisor, is a good one, that any commitment of funds before grant funds are approved means that really relies heavily on the counties, meeting that need. So this is one way to look at the issue here in terms of, depending on where the use goes, and at a range of possible impacts if the county were to fully subsidize all the long haul cost, or maybe at a lower rate, having somewhat reduced exposure. Keep in mind that that revenue from the business, both to the county as well as to the well-being of the community, is substantial. So one other simpler slide I wanted to put up here is this one, which is kind of a view from the user perspective. No county subsidy means that somebody buying a truckload of 3,500 gallon truckload of water on the coast after paying all of the long haul costs is going to approach $1,400 a truckload. The current, pre-drought rate for that service is about $400 a truckload. So a pretty substantial increase. If the county were to pick up some amount of that, you could see where this number might get, subject to meeting the cost projections that we have. So this is another way to look at potential discussion around this question of subsidizing the long haul costs. So I see Supervisor McGorty has his hand raised.
Thank you, Josh. I just wanted to add to it that Supervisor Hasjack and I got together with the Lodging Roundtable, which meets Monday afternoons every week. And normally Supervisor Williams goes, but because of the Brown Act, he kindly allowed Supervisor Hasjack and I to take his place. And there was quite a discussion among their membership about the costs and about how difficult it would be for them to operate on the high end of this scale. And what we have to kind of think about as a board is that this drives the economy of the coast. So it's not just that you would subsidize water for the hospitality industry, but there's also significant employment in the coastal community, not just around Mendocino, but all the way up to Fort Bragg, that depends on this industry doing well, plus our own income through TOT and sales tax is substantial. So we have to spend some time thinking about how we want to view this and what, if any, action we want to take to be sure that we continue to have a healthy industry. And they're at the moment they're feeling pretty good about the fact that they've had a great year, and all indications are the next couple months look great as well. But it's obviously be a disaster if they have no water, or if they can't afford water. So we've taken care of the first part. You know, we've been very proactive as a group, and we're making sure that they will have water available. Now the next question is going to come up whether they can afford it or not. And I just wanted to insert that so that you're getting a sense of the angst that they're feeling. Supervisor Hasjack, do you have anything to add to that?
Well, thank you, Supervisor McGordy. You know, I do think that, you know, with the commercial entities on the coast, that, you know, there's considerations like, is it possible to limit the number of water trucks that we subsidize for each business? You know, like, okay, there's probably a big difference between a big hotel versus a small bed and breakfast. And so I'm just trying to think about what kind of alternatives we might have. And I don't know, you know, just throwing out options out there. Does that make sense? Like the county could subsidize 1 truckload of water per month. And then after that, you're on your own. Or, you know, there's a million kind of ways we can divvy that up too. So.
Okay, thank you. We have 2 other hands raised, Supervisor Williams and then Clerk of the Board.
And does your task force have a recommendation based on what you heard yesterday from lodging? And where do you think the sweet spot is on subsidizing using dollars that would otherwise be lost? In other words, if we just let the natural progression move forward and business shuts down, we're going to lose some tax base, sales tax, and a lot of TOT. What is that amount, and what does it look like if we reinvest that amount in water? And then I guess secondarily, what do you see for next year? We may not be in a position with the state to be getting reimbursed again. What can we do to encourage storage? As much as I would like to see some towns, especially the town of Mendocino, invest with local dollars and hopefully some matching grants from the infrastructure bill, a water system that would include extraction, collection, treatment, distribution. I don't see that as being feasible, probably for installation within the next 3 years. The way government moves, maybe 5 years. My read is the only option on the table is for individual houses and businesses to invest in water storage to get through the dry season. Is there any way to tie that into the current plan? We're subsidizing, but this is a one-time subsidy.
So part of what we're suffering from a little bit is not having really exact information, because we're now just putting together our hauling plan. I don't know if well, Howard DeShiel is here, so he might be able to tell you a little bit about some of the variables, but we haven't really pinned down an exact number. So that's the first thing that we're having an issue with. And then the second thing is, as Darcy Antle pointed out, we might have the possibility of having all of our hauling costs subsidized, which would also change the price. I'm sure that this is, well, I don't know. I suspect that every facility is different in terms of their profitability and overhead. And in general, the way it works, usually the smaller you are, the more sensitive you are to changes in overhead because you're working on a narrower margin in most businesses. But I don't know that that's the case, and this probably needs a little bit more study. But anyway, that's not a perfect answer. I would strongly encourage anybody who's water insecure to invest in more water storage and try to fill their tanks in the winter when their wells are working properly, because you can go pretty far with a 5,000 gallon tank of water. That should last you at least a month with modest usage.
Based on all of the data points you've gathered, what is the recommendation today?
I'm still a little bit reluctant, and maybe towards the end of this conversation, we'll have a little clearer idea.
Okay, going to the clerk of the board, then it's the Deputy CEO, Janelle Rao.
Darcy Antle, Assistant CEO through the chair. I would just like to add to what Supervisor McGordy was just saying. These numbers are estimates that we used early on in our assumptions, and we continue to refine those numbers. And I think the director of GSA, Janelle Rao, can add, or the incident commander, Howard DeShield, can have some more comments on this as well.
So, Mr. Chair, through the board, Howard DeShield, Director of Transportation. I believe that the GSA director who's working on the emergency informal bid process had planned to report out during our discussion later today over the mutual aid agreement. So I'm not sure she's ready to do that now. I think, though, whether it's 20 cents, 27 cents, 37 cents, there is going to be a cost above and beyond what the public is used to paying for hauled water on the coast. So I think the board should maybe have a policy discussion without really knowing that exact amount. I recommend you do something very simple in percentages, because we've worked out an arrangement where we would need the private haulers to collect this from their customers and pay the city of Fort Bragg. Again, that's a discussion for the mutual aid agreement, but we need something really simple from the policymakers.
Okay, Josh.
Oh, thank you, Chair. Yes, I have a few points to add and include. I did put a little recommendation slide in here for you to help. So I followed up with some further questions from the lodging folks the other day. That particular question, actually, that Supervisor Williams asked, because we heard, on the high end, that's disastrous to the business. And I said, well, what is not disastrous but helps get you through? And one thing I learned was most of the hotels historically have not had to haul water. So it is a unique circumstance that they're facing. But really, the number that bubbled up in those kind of informal conversations that I followed up on was somewhere close to the $600 to $800 window. So that would be in your 50 to 70% subsidy rate. And of course, the lower number is preferred by any operator who hasn't had to kind of pay for this resource before. And I think, anything that the county could do to support the businesses would be well received, and I think would keep those revenues coming in. So this this is the set of recommendations that I kind of came up with, and I think it aligns with the conversation we were having in the ad hoc and what we've been talking about here. You know, consider this subsidy for the long haul water to the coast, somewhere between the 50 to 70% rate. I consider potentially allocating TOT revenues for that purpose. I think, you know, what we're hearing is that you know, because the visitation, rather than taking a big hit this year, as some were projecting, has actually been pretty strong. There could be additional revenues that were not projected, and of course that's subject to, you know, folks like Darcy and her team getting specific on that. And then I think the key here is to monitor the use pattern and adjust the policy as better data comes in. So we really would work with our partners at the city of Fort Bragg and the local haulers to get very clear on where the water is going, what's the use, and then be able to come back after a month of operations and say, you know, X% of the water was used for this purpose. And so, you know, that would, I think, be quite informative. So, you know, I think to Supervisor Williams' question earlier about sort of a, you know, how much impact this might have to a, you know, 1 month operation to the county budget. You know, it's somewhere around $300,000 to $600,000 potentially. You know, if all of the water were used for, you know, if all of the water were used, the 75,000 gallons were used every day, and the county was paying full boat for that here, you're talking $20,000 a day. If half the water is being used, it's $10,000 a day. So that's where that number comes from, 300 to 600,000 for a month of operation. So not simple, not fun. We're dealing with many different challenges, you know, as you all well know. But I hope the information that the ad hoc has developed here and is useful for your discussion.
Josh, so I appreciate all the information you and the ad hoc and Howard, Janelle, and others put together, and Darcy's team. Some thoughts I have is I would like to see, and I know we don't have a lot of bandwidth, but in sort of an after action analysis. So I'm assuming that this model will be expanded out to other parts of the county, and but particularly what I would like to see is anyone that receives this subsidy, regardless of what the subsidy is, and I'm leaning towards a higher subsidy. What I would like to see is that afterwards we look at every single property owner and see how much water storage did they have, and have they are they moving ahead with additional water storage between now and next fall? Because what I would like to see is a substantial subsidy. Ideally, the state grant kicks in about 4 weeks, but that every single person who receives the subsidy, either from the county or the state, commits to expanding their water storage on site. Because I don't want to see this, even though we may have to ramp this up again next year, I'd like to see fewer participants next year, because more people have enough storage on site that they don't need to accept long haul water. Because ultimately, this, in my mind, is not really the best solution. You know, hauling water by trucks around the county from one watershed to another is not really the way it should work. So anyway, so that's what I would like to see, is a deeper subsidy this year and a diminishing subsidy in future years. But we have this as a backstop. But what we're really looking for is for each property owner to step up and add more water storage between now and next winter. Supervisor McGordy and the Supervisor Hashak.
I think Supervisor Hashak had his hand up first, actually.
It doesn't matter, but I'll go ahead. Okay, so I guess we're trying to make this as simple as possible to get it going. And so that there's been questions about means testing for, the recipients, whether they're individuals or businesses. And I think that I'll speak for Supervisor McGordy and myself. I think that that just provides a little too much complexity to get this going quickly. Because if a person has a $1 million house on the coast, do they need to be subsidized by the county? But right now, I don't think we're in that position to make those kind of judgments. With the businesses, I think we need to consider what happens to businesses throughout the county if we do this program of subsidies. Then what happens when the ranch or the cannabis farm or whatever kind of business in Covelo or Redwood Valley or Potter Valley goes out of, needs water hauled? And that's a question for kind of the long-term aspect of this. And then with the TOT allocation, the TOT goes into the general fund. So we're really looking at general fund money. And I think what we talked about last week was the kind of the marketing budget. And if we could use that, because that doesn't seem like we need to be marketing people coming to the coast if we don't have the water. And I think a lot of that resonated with people that I've heard from. And the goal is to replace that PG&E money, the 1.5 we committed, 1.5 million. Let's replace that as quickly as possible. So where will we find that? Is a question I think we need to really grapple with too.
Okay, Supervisor McGordy, then Supervisor Williams.
So remember, this is kind of a unique situation because in many other parts of the county, we have water. We have people who can haul. The coast is really has a major problem in that there's no place to get water locally. As we've designed this program, what we tried to do is work with existing infrastructure and systems. So that includes also private water haulers who normally supply the coast. We've tried to keep things as simple as possible and tried to keep the role of Mendocino County as simple as possible so that we can have a fairly well-designed system that doesn't overburden county staff. And I think we're doing pretty good in that department. So if we think about other parts of Mendocino County, they're not quite in the same dire straits that the coast is right now, and hopefully won't be, because we do have available groundwater in many other places that could be used for hauling. The coast is just a uniquely bad situation that long-term needs to be addressed. And I think the coast has been looking at this for years. And this is probably the time, with the way climate's changing, that it'd be a good idea to take some action, because I don't think this is going to go away.
Okay, Supervisor Williams, then GSA Director Janelle Rao.
Could we also give staff direction to come back with a breakdown of where the TOT has gone in past years? And I know it goes into the general fund, but we must have some sense of, once it goes in the general fund, where it's been allocated. The reason being, part of the reason for collecting bed tax is to offset the actual costs incurred by visitors. Visitors damage our roads, cause all sorts of EMS and fire calls, cliff rescues, water rescues, medical aid to hotel rooms, and now are impacting our water availability for residents, some who are rather vulnerable. I think it may be that the bulk of the TOT goes to the general fund and is used throughout the county. Some of it should be used to address the actual impact to the communities that are hosting the service. And I think we see this with other taxes, with the cannabis tax, which is about the same amount of money as the bed tax. A lot of that is being used for enforcement. code enforcement, law enforcement. It's used in the same industry to clean up some of the illicit activity that's happening. And, that's more inland than it is coast by far, just like this is more coast than inland. But I think we could do a better job for public benefit tying the tax collected with application. Is that something we could give staff direction to come back?
I would support that.
Sure. I think we might get the report after the drought's over.
Well, that's okay, because this may not be a one-time drought. This may be the new reality in Mendocino County, that we can't rely on annual rainfall.
Okay. GSA Director Janelle Rao, and then going to the clerk of the board's office.
Thank you, Mr. Chair, members of the board. Janelle Rao, GSA Director. I just wanted to give a little bit of insight and clarity on the processes we've been going through. So, since the declaration of the drought emergency, the logistics team has been soliciting and looking for haulers for potable water. And I just wanted to make sure that there was some just transparent information. We've had one qualified hauler that has been responsive throughout. These have been phone calls. We've done PSAs. We've done press releases, and we will do a formal solicitation via our incident command, Howard DeShiel, once we get through this emergency process. But the one hauler that was qualified that did respond is also from out of the area. So the costs that we're talking about here, I think they were preliminary, as ACEO Darcy Ansel mentioned. But I think the reality is you're going to see that a lot of these haulers that are local are either not qualified, not certified, or simply not interested. And we will continue to do our best. We will continue to go through this. But I just want to make sure that we're being as realistic as we can in how we're going to address this. And I wouldn't know yet what the costs are, but with an outside hauler such as this, we're also going to assume that there will be some per diem costs for these drivers as well. And the gallons that we're talking about, we've got one hauler right now, and I'm not even certain the amount of trucks that are available and how many gallons we'll be able to transport. So I know that we've been working really diligently with Howard and his team, but I just wanted to make sure that this board was aware. Thank you.
Supervisor Williams, you have a follow-up?
What would it look like if we were to lease a couple potable water trucks and use, say, our DOT crew for hauling?
Mr. Chair, Howard DeShiel, DOT Director, through the board. I'll see if such trucks are available for lease. I also know some of the larger tankers require a tanker endorsement, so I'm not sure our drivers would immediately be able to drive them, but I can start looking at that.
Okay, thanks, Howard. Going to the chambers.
Chair Jurdy, this is CEO Angelo. I just am asking for clarification on the question that Supervisor Williams had. We will take that as a directive regarding the transient occupancy tax, but could we have just clarification? Could that directive be stated again, please?
Come back with an analysis of TOT use over the past decade. And commentary. I think what we're looking for is, perhaps $40 million of TOT has been collected from a couple towns on the coast over the last decade. I don't know that we've seen even 1/5 of that used to address the problems it's created. We still don't have sufficient trash pickup. We have roads damaged by tourists. We have fire and EMS responding to a lot of tourist-related calls. We have fires from tourists, and now we have a water shortage in part because of the visitor economy. I think we're looking for, ballpark numbers, maybe rounded to the nearest $250,000. How much of the TOT goes to address the impacts of visitors?
Okay, so thank you. Then clarification, over the last decade, how much transient occupancy tax came in annually, where it came from, and I think we at least over the last couple years, we're well aware that close to 75% of the TOT does come from the coast. So how much TOT per year, where it came from, ballpark there, and where it went within the county system or outside of the county system. So we will work on that as quickly as we can. I don't have a time frame. We have to work with the auditor's office on this. So I'm assuming 30 days. I'm asking our assistant CEO. So we should be able to come back with that within 30 days is our hope.
Okay, thank you. Supervisor Hashak.
Thank you, Chair Jurdy. Another thing that hasn't been mentioned is that we're going to the Willett City Council to see if they're interested in participating in this program. And if they can provide some water for the coast, then it's a shorter haul from Willits to Fort Bragg, and that would cut down the cost too. So we're looking at those options too. And we have had water offered from Laytonville also. So we're looking at those options and trying to see if that can cut down the overall cost.
Okay, if we're done with, Josh, go ahead.
Oh, thank you, Chair. Just a great discussion here and questions. You know, I think it is helpful to get the full board's attention and feedback on these items. I just wanted to follow up on what you said actually about the after action analysis. And, you know, I think that finding a way to, you know, do this subsidy initially and take some of the urgent kind of pressures off of folks there, I think what I heard would deepen an already strengthening relationship between the county and the lodging association and the sort of focus on the economic well-being of the community. I think that will go a long way to, you know, saying, hey, you know, the county has stepped up here in a significant way. So we are looking to, you know, we need this information. We need to know where the water's been going and what are the status of the water infrastructures at each of these places so that we can kind of track and set up a strategic approach to solving these problems. So I think it's a really good idea to, you know, kind of tie that together, you know, the action by the board and supporting the moment, and also then the ask to the business community to like fully engage in a proactive way to help you know, deliver data and navigate this longer term kind of solutions. So just supporting that, and appreciate your attention and thoughts on these items.
Okay, thanks, Josh. Do we have any public comment on this agenda item?
We do. We have Samir Tuma. You can begin speaking whenever you're ready.
Hi, this is Samir Tuma. I'm the owner and operator of Inn at Schoolhouse Creek and cottages at Little River Cove, and I've also been very involved with the lodging group as we've gone through the process. I spoke to you folks last week as well. First, I want to say we are super appreciative of all the effort that you've put in, and particularly on the task force. The process of just getting something going here is not easy. We understand the challenges. We did have a very productive conversation with a couple of supervisors yesterday on our weekly call, where we expressed concerns regarding the ever increasing price. And I don't want to rehash a lot of the things that have been talked about this morning already, but I do think, kind of fundamentally where the lodging group comes down on this is that we are partners with the county. We have been generating millions and millions of dollars in TOT for years. I think this last year there was a significant increase in TOT, And what we're really asking is that, you know, a portion of that increased collection be allocated towards paying for this really unprecedented increase in prices. People sometimes talk about, you know, that we all have, a lot of us have wells, and, you know, that our water's free and that sort of thing. And I got to tell you, maintaining and installing water systems is extremely expensive. And so we have been, you know, really trying to manage through this time of COVID and now the water issue. And you know, what we really just don't want to see is inns begin to shut down again, laying off the workforce once again, and creating more economic hardship for the community as a whole. The flip side is, if we can keep the lights on, if we can keep the water flowing here at a reasonable cost, then we will produce more tax revenues that will more than offset the cost. We're projecting over $2 million a month in TOT and sales tax for the next 2 months, which is critical timing. And we just believe that returning some of that money to the source that generated it to support us in a time of need is something that would be not only very much appreciated, but is the right thing to do. And so would really support, really ask for the maximum subsidy that you can do here. I think we could, a postmortem is a great idea, and we'll get a sense for what that means for next year. One just quick comment about Supervisor Jurdy's comment about extra storage on the properties. It's helpful, but when we run out, and the wells don't produce, so there's nowhere to store it. Thanks very much for your time.
And that concludes public comment for this item.
Okay, right. So we'll go back to the board. Maybe Josh, maybe you could pull that slide back up, or one of your slides that might be helpful for the discussion. Supervisor Hashak.
Thank you, Chair Jurdy. Yeah, I was hoping that Josh could put that slide up with the cost. Let's see the next one, not that one. You had one.
Which one do you like, John?
You had one with the dollar amounts. And
this one?
No.
Okay, so then these are both dollar amounts.
Leave it
this,
here.
Yeah,
Yeah,
this one's the potential daily impact at 75,000 gallons. And this one is, sorry, this one is the cost to a buyer of water. And this is your county subsidy rate down here. So this would be 100% subsidy, 0% subsidy.
So if we went on using this chart, if we did a half a subsidy,
yes,
and we would get to a point right here about $900, it looks like.
That would be the cost that a buyer of the water would have to pay for a 3,500 gallon truckload of water.
And if you go to the previous slide, if we look at subsidizing individuals at this point, at least for the first month,
right,
at 100%.
Right. So that would be right here, your daily cost. If all the 75,000 gallons per day were used, whether it's commercial or domestic, at least until the grant programs were approved, you would have this about $20,000 a day exposure at 100% subsidy. Right.
But what you were thinking was that if we did, well,
which amounts to about $600,000 in a month.
Yeah. But if we did 100% for residential use, and 50% for commercial use, then we would be somewhere around here, it looks like, in the middle.
Yeah, that's not a slide I put together for this thing. It's probably one I missed, but Yeah,
But
so I
You
think-
you were saying yesterday that you thought that, and this is just an educated guess, that 25% of the total usage would be residential and 75% would be commercial.
that's mainly because the largest, the strongest advocacy is coming from the, commercial sector at the moment. So that's and in that case, I think we ended up with around $90,000 for subsidizing the domestic, and about 200 something thousand for subsidizing the commercial user. That would be the cost to the county.
So it seems that, yeah, I remember that slide that you don't have that slide.
Let me see if I can find that one. Give me a second.
But what I remember, it was about 85,000 for domestic use a month. And then maybe 120,000 for 50% of commercial use.
Okay, here we go. Let me put this slide up here and hope it's the right one. This is a real-time calculation. So this is what you were thinking about. This is where we were looking at domestic use, 25% of the hauled water, commercial, 75% of the hauled water, and 3 different policy scenarios. So assuming that the county is covering 100% of the domestic, your cost would be 86,000. Again, at the assumed hauling costs, which I think were pointed out, we're all subject to actual market validation. And in this scenario, if your county is providing 100% of the funding, you have a $350,000 per month exposure. And this one, now I gotta look. Okay, so that's a 70%. That's right. Okay, so this is if you're subsidizing 70% of the haul cost, it's about $200,000.
What if we did 50%?
So, combined with the cost for the domestic, you're talking about 215,000 total.
Right.
Right.
Well,
so that gets, yeah, I think that, and then that gets back to what's that going to do to your price here? Your buyers are going to pay about $900 for a truckload.
For commercial.
Yeah.
And for residential, they would be paying about 400.
Yeah.
Well, I would move that we subsidize for at least the first month of, full subsidy for residential use, and then a 50% for commercial use. And reevaluate, monitor it after a month and see where we are with the state grants, see if we have more information about how that 75-25% split is happening, and if there's a way of means testing.
Okay, is there a second for the motion?
So I can I just address this a little bit based on what I heard, and then I also have a question for Supervisor Williams. So it seems to me as what I heard is that kind of their maximum pain point where they feel they can absorb the cost for water is around $600 a truckload, and does that kind of sound right to you, Supervisor Williams? Is that where the pain starts
Well-
to really go up?
Well, yeah, I mean, a lot of this is anecdotal. I've heard $400 to $500 they can sustain. At 900 to 1,000, most business will shut down. Where that line is in the middle, I'm not sure. I think your guess is probably close. And so when we look at the total, we're assuming that all volume of water that's needed will be purchased. I don't think it will at $900. I think there are businesses that will simply close. And it's hard for me to analyze who will be affected. It's not just lodging. If you don't have the visitors, retail suffers, those employees suffer. Suddenly the employees can't afford to buy water at $400 because they don't have employment, right? There's a trickle down from this problem. So I think it's looking at the amount of TOT we're going to lose is one valuable metric. Looking at the impact on vulnerable wage earners is another and arguably more critical.
So that's kind of my concern is I feel a little bit like we don't quite have enough information to make a really, really good decision on this. But if I'm remembering correctly, $600 seems to be about the inflection point at which probably it makes it very difficult for a lot of the businesses to continue. And so that represents what, about 70% subsidy, Josh? Is that about where
It looks about 80 on this chart. 70 is about 700.
Mhm.
Yeah. I think the key point is we need to be able to run a program and gather data over a month, and so I think whatever you decide, we should definitely do that. But I think I've heard in my conversations with the folks, the lodging folks, the 600 number kept coming up as something that was closer to palatable than the other ones we were putting out there. And again, I think it's important to consider the impacts to the community and impacts to the revenue that higher price might deliver for you. But this is the information we have, and I would work so that we're back here in a month with a much better sense of what's actually happening.
So could you, Josh, could you go to your other slide again, that with the multicolored lines, and let's look at 80% and what that looks like in terms of where we end up spending money.
So so that one, if again, assuming I think what we're looking at for this first month, because this slide doesn't address the aspect of needing to have grant approval before we're getting any real subsidy for even domestic, is that in the first month, you would be looking at, if assuming all the 75,000 gallons a day are utilized, the the cost impact here looks to be around $16,000 per day at an 80% subsidy. So not wanting to do my math on the full board screen, I could do some on the side here and figure out what that number is.
Hey, Josh, while you do that, do we have any other comments from board members?
Yeah, I have a question. What do we anticipate TOT will be in the next month? And how does that relate to the subsidy that we may offer? Are we using a portion of the TOT that we expect, or are we exceeding it?
I don't have the TOT revenue projections. Maybe Darcy would have that. I can tell you at $16,000 a day, you're looking at about $480,000 in a 30-day period. So that would be the
Josh,
yeah. Mhm.
If we did the 80% though, and this is saying 16,000 if we did 80% for residents and
Right.
domestic and commercial.
Right.
So if we did a higher percent, if we did 100% for domestic, it would be a higher amount.
Correct. Mhm. Correct. So maybe that would be 18,000 a day, say. 540,000.
Okay, we're unmuted.
If I may, through the chair, Darcy Antle, Assistant CEO. I think right now, I don't know your schedule. I mean, I kind of know your schedule. Sorry about that. But maybe we need to take a break if you really want to dive into the numbers. And then we can work with Josh to flush this out a little bit better. It's feeling a little on the fly for those of us in the fiscal area right now. I don't know if perhaps Incident Commander Howard DeShield would want to make a comment, but maybe we could take a break, or we could bring back something to this board later to get to the real, if you want real numbers. Because again, these are estimates that we have based on prior assumptions.
I like real numbers.
Yeah, I do as well. We're having to make a very big decision with a lot riding on it, in terms of not only what we're spending, but also people's lives. So I want to be sure if we do this, we have good data to rely on.
Okay, let's see. We could either, it's now 10:30, it is actually time for a morning break. So let's come back at 10:45, and we'll either come back to this item or we'll go to another agenda item and come back to this later today.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe. By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
我们能够做到.
Podemos hacerlo por todos nosotros. ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso. Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom, it was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
for all of our lives
against COVID-19.
The virus keeps changing into new variants,
which is what viruses tend to do when they spread.
Some variants are more contagious, while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year,
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone, especially the most vulnerable among us. We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
For our patients,
for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic,
We need to be kind to one another.
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
我们能够做到。
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye Mape,
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
We are so lucky to live in Mendocino County.
County staff working on the
Is
financial figures
reflected
we
in the
asked
hearts of the people who live here.
We may not all look
And
alike
so
or sound
I'd like us to go stay on the general topic of water, but move over to 6B, and then we can come back to 6A after we conclude 6B. So 6B is discussion possible action, including direction of staff to draft an urgency ordinance regarding the prohibition of water hauling from one source to another, except for health and human safety or permitted business uses. And this is coming from the Drought Task Force, Supervisor McGorty and Hashak.
Well, I'll start it off if Supervisor McGorty's all right with that. Is that we're hearing throughout the county lots of stories of, water theft, and which is a, critical issue in this time of drought. And then also just water hauling. So if a person has a deep well that's producing a lot, that there's a lot of people who are selling it, and neighbors are concerned the water is hauled off from their property off into the hills for the most part. And so we've got an issue where people are getting very concerned about where their water is going to come from if the aquifer is going to be depleted, and all those issues surrounding that. So certainly there are water districts that are selling water that get hauled, and there's legitimate uses for water, legitimate businesses and so forth, construction projects, residential uses, farm, ag, livestock issues, that we need to be considering. But at the same time, it seems that there's a lot of water being hauled into illegal cannabis grows, for one thing. And so I think that Supervisor McGordy and I are just trying to open up a conversation to look at some of the different aspects of, the water source, the vehicle used, and what we can do about that. So Supervisor McGordy?
So, in kind of researching this, there's kind of three different areas that you could take a look at in terms of having some sort of legislation. So the first one is groundwater control. There are actually, I believe Tehama County restricts the movement of water out of basins, particularly for illegal cannabis. So that's one way that it's done. But the problem with that, of course, is that you have to have some sort of monitoring going on. So that's either meters or somebody knowing about the activity of the pumping and so forth. Another way to do it is vehicle control. So Siskiyou County has a very vigorous program where essentially they have no cannabis ordinance. Cannabis is illegal, but they have almost 5,000 illegal grows. So they're in a really difficult situation, and they basically have banned the movement of water on any county roads for the purpose of supplying cannabis farms. So they seem to, the sheriff there has really embraced that, and working with the highway patrol, they've impounded numerous vehicles that aren't actually properly registered for road use. And then the last way you can do it is really with permitting control. So that's one of the things that the new 2218 ordinance would do, is basically not allow you to permit a cannabis grow if you're dependent on truck water. At the moment, under 10A17, if I understand it correct, you can have a grow that's supplied by truck water. And this is where kind of the difficulty comes in a lot of cases is, this is a very common complaint when people are in a neighborhood with cannabis grows, is that there's truck water going up and down the road. And under 10A17, some of that's legal. So that's one of the things that will be our default ordinance if the referendum is passed. So that's something for us to take into consideration. So those are that's kind of the thumbnail sketch of which way you can go with legislation on this if the board wants to do something. I didn't get the sense in talking with both the district attorney and the sheriff that they were real excited about having to do enforcement on this. The district attorney, from the perspective that the water is not worth very much, so it's in his way of thinking, it's not a horrible crime from the perspective, particularly of water theft and property. And that's kind of what he had a discussion with Supervisor Haschak and myself about. And the other issue for the sheriff is that a lot of the water transfers take place at night when they're not really staffing up. So that's kind of an issue for them as well. So these are all things for us to think about as we have this discussion. This will kind of help frame some of our thoughts.
All right, thank you. Supervisor Williams and then Supervisor Haschak.
I've heard concern from ranchers that this could impact their ability to keep their animals hydrated. And I think it would be good for the board to clarify that it's not our intent to impact livestock having access to drinking water. I see that as part of health and safety. Is that?
Yes, that's absolutely correct. So
Okay.
We're really only talking about providing water for illegal cannabis grows.
So that helps. If that's the case, if we're really just talking about outlaw cannabis cultivation and water hauling to outlaw cannabis cultivation, we've gone in circles in the past. No matter what rules the board puts in place, no matter what direction we give, it'll be ineffective without enforcement. So I think the real discussion topic here is what is the proposal for enforcing water hauling rules to illegal activity? And I think the sheriff, I can't speak for the sheriff, but I think if he were here, he would point out he has a lot of high priority reports of crime to respond to. And although we're in a drought and this seems critical, he has his hands full. He doesn't have enough resources to do the job as it is. So I want to be careful that we don't just set a policy and tell the sheriff now go enforce it without giving him resources to staff up. Same with code enforcement. So what is the proposal to fund the enforcement?
Supervisor Heschak?
Yeah, those are good points that we've certainly talked about it, and we need code enforcement, we need law enforcement in on whatever we do, whatever direction we do. And so, Trent Taylor did some research and came back with what they're doing over in Lake County, which they just created an urgency ordinance about a week ago. And really it was, if Trent Taylor is on the line, he could explain what they're doing. But it's kind of like if they're looking at something else and they find that water is being diverted, hauled to illegal or unpermitted cannabis grows, then they deal with it. And there's a penalty associated with that to make it less desirable. So we have to put in a penalty that would make it significant enough that people don't want to do it and get caught. And, we also talked about prohibiting water hauling at night, which seems to happen. And, if they're doing it at night, it's probably not for the best means and reason. So anyway, it all boils down to what can we do with the enforcement of it. And maybe if Trent Taylor is on the line, that would be good to get his perspective.
Okay, looking to the clerk of the board, do we have any relevant county staff, code enforcement, sheriff's office who are in the waiting room that could be brought into the meeting?
So not currently. We have sent the information off to Trent Taylor and we are trying to get him on the line right now.
Supervisor Mulhern.
I just have a question about the agenda summary. I think I would have been better prepared for this conversation if it had explicitly stated that we were talking about illegal cannabis cultivation. So in the summary, it says private wells are selling water that's transported to distant locations for unpermitted usages. Are there any other usages that we are considering, or are we only talking about illegal cannabis operations?
Well, I think the majority is happening for unpermitted cannabis grows. I think that we need to be cognizant that there are all these legitimate uses, ranchers, all that who have it for their livestock, and there's construction projects going on, there's road projects, there's all these legitimate purposes. But I think that throughout the inland part of our county, there's a lot of water hauling for illegitimate purposes.
So I guess my next question would be, so if somebody had a construction project that didn't have permits, then we would be considering what our options are for limiting them to have hauled water. Same with any kind of like road grading and that's what we're discussing.
Supervisor McGordy.
Well, this brings up kind of the whole point of discussion is that it's very hard to really regulate this because there are a lot of legitimate purposes. So we're still able to purchase water to wet down the roads during harvest if they're involved in agriculture. If grading a road doesn't necessarily require a permit if you're touching something up. but you may still need water to wet it. So these are all the difficulties, and that's why I think that the Lake County approach, if it's an add-on, if you're basically in trouble for an illegal grow and code enforcement comes in and then says, what's your water source? That's probably where, that's about the only thing I can think of that would be easy for us to enforce. The other point too is a lot of the truck enforcement is done by the Highway Patrol, which of course we have no control over them whatsoever. And we can't really do anything to you know, other than cooperatively work with them. And I'm sure that they have lots of priorities as well. So this is difficult. You know, I really kind of sense the problems that the third district have with this. It's obviously the biggest cannabis district, but you know, I sense the public pressure, but frustrated in terms of what we can really affect as a board with our policy and our ordinance.
Okay, so I do see that John Burks from Code Enforcement's joined the meeting. John, have you been able to listen to the meeting and follow the discussion?
Hi, yes, good morning. I have been following. Thank you.
So do you have any feedback about how this ordinance would be enforced, either by, well, vehicles are either through sheriff's office, deputies, patrol vehicles, highway patrol, et cetera. So how do you see that this ordinance could be enforced?
Well, needless to say, I can't really speak for any of the other agencies. Code enforcement's kind of unique, being, you know, non-peace officers. We don't really have any jurisdiction over vehicles. Typically, we hold, you know, property owners accountable. It doesn't mean that we can't. I did read Lake's ordinance, and they have an interesting perspective on that. But we'd really need to consult, you know, counsel and have some strategy discussions behind the scenes, I think, to try to find a pathway. But I think the bigger question right now is with the enhanced cannabis enforcement plan that we're still working on, which is going to address some of the aspects of, you know, the non-permitted commercial cannabis cultivation in the county. We're currently staffing up for that previous board direction, and we're right in the middle of recruitment, hiring, and training. So we think that we will have some impact, but again, you know, we still only have 5 field staff for all of the priorities, you know, related to code enforcement at the moment. So I just wanted to throw that out there, that we're in the process of bringing, or actually we're going to basically triple in size. It's just the timing's not great, unfortunately, because by the time we get the resources ready to go into the field, it'll be a few months from now, which hopefully the severity of this will be over. But planning ahead in the future, I think that we certainly can develop a strategy if we have the appropriate resources. So I'm sorry if that didn't quite answer the question, but I did want to cover a few things in the conversation.
Okay, thanks, John. Sheriff Kendall, I don't know if you had a chance to listen to the meeting discussion so far. What do you see as the capacity of the sheriff's office to help enforce an ordinance like this?
Well, it's one of these things where Supervisor Williams is absolutely correct on this. The capacity right now, when we're running at about 21 out of 40, is not good. We have a lot of injuries. We had a lot of retirements. We're working on hiring up. And then on top of that, there isn't a lot of teeth left in the law. It would basically be a 488 misdemeanor theft, nonviolent crime, which is basically clearable by a citation only. So depending on what the judge decided to do with that citation, and of course, you know, our district attorney would absolutely file on it, but it is a misdemeanor worth about, you know, I imagine $50 worth of water in each truckload. The only time that it becomes a felony is when we have it stolen from the Eel River, from one of these watersheds. When there's a stream bed alteration, then we can work on that, but that would have to be with the assistance of Fish and Game. I've had a couple of discussions with some of our legislators, especially during these drought times, regarding trying to get some enhanced teeth to go after it. But a lot of our water haulers that are hauling to illegal grows are taking it from a legal water source. They are. They're purchasing it from various legal water sources. And so the legislation behind this would be interesting, to say the least. And I'm not sure how we can get ahead of it. The Highway Patrol worked with us very, very well with their code, or their big vehicle enforcement units. And we see some water trucks, they see some water trucks, but it takes one of those commercial highwaymen to be able to do the seizure on those. So I'm not sure how we could get over that hurdle.
So I'll ask a question of County Council that the ad hoc may have already asked. If the county had a specific civil fine to add some teeth to an ordinance like this, would that help and bypass the criminal law issue, and just say within Mendocino County, due to this county ordinance, to transport water, even if it's from a legal source, but to an unpermitted site, unlicensed activity, would be subject to a civil fine in Mendocino County? Could such an ordinance be written, and would that be helpful?
So to answer your question, Mr. Chair, it may be possible to go ahead and do an administrative penalties ordinance that might impose some sort of a monetary penalty that might serve as some sort of deterrent there. There are a few sort of obstacles. One is that code enforcement, I think, as currently set up, is really sort of focused on real property and going after landowners as part of the hook. So you don't have quite the same tools that, say, law enforcement might have when we're talking about a vehicle or a hauler, particularly if they're not operating from a place of business within the county. So that's not to say that would be zero benefit, but the tool might have a little bit of trouble on this particular issue. And then additionally, I'd note that the code enforcement penalty structures are sort of designed to be coercive and to get compliance, rather than primarily to be punitive and to be getting deterrence. So I'm not certain that you're necessarily going to get the best results there. I mean, typically the mechanism is to go ahead and cite it, give them a chance to abate, and then have penalties that increase over time. So if you had, say, a business that was, or if, for example, you went with the Tehama County model, where you required a permit before any groundwater extraction to be transported off of the parcel, and someone was operating without a permit, you could then notice them up. They'd have to apply for a permit. They'd have to cease their operations in the meantime. And then, once they had the permit, they may be able to, you might have some sort of regulatory tools that sort of help track, where the water is going, what it's being used for, et cetera. Although that gets into another issue, because I think Sheriff Kendall has mentioned that a lot of these sources may be legal. So you could have a situation where essentially someone is lying as to the destination or the purpose for which the water is being purchased. And that might present some obstacles from an enforcement and a compliance standpoint as well. So I would say I wouldn't view it. Administrative penalties is a tool that you have. I wouldn't view it as a cure-all. And there's going to be some challenges if you're trying to apply it in this context. And you may want to make sure that if you're going to do that, you try and structure any ordinance and any prohibition to something that would sort of be useful from an enforcement standpoint. For example, source management, as opposed to hauling, rather than trying to just apply the tool to what is what is otherwise defined as the problem. You might have to work at it a little bit differently.
Okay, thanks for the feedback. Supervisor Williams?
Yeah, recycling an idea that I proposed previously that might maybe the sponsors would consider today. The business license for water haulers and the business license for those extracting and selling water could require a log be maintained and submitted to the county that would show the gallons, the date, the location filled, the location delivered. And I think by requiring it of both the sellers of water and the water haulers, we would be able to cross-reference. So there'd be a bit of a check built into the system. Those should match. You shouldn't have a water hauler showing that they're delivering from a water seller who is also not reporting and vice versa. And it would it may mitigate the need to involve enforcement where we don't have sufficient resources today. And it would give us some data. We could start charting how much water is moving into where. I mean, one of the larger problems is it seems the county and state, and people say it's the county's cannabis program. It's really not. All we do as a county is permit an applicant to file for a state license. It's the state's program. It seems that there are hundreds in the quote unquote legal market who don't have water, don't have wells, no water plan at all. The plan was to haul in water. So I wonder how many of those that we're talking about that are creating a problem for communities are actually permitted and licensed versus just purely outlaws.
Okay, Supervisor Hashak.
Thank you, Chair Jurdy. So yeah, on the summary of request, it does say that, log of details of each delivery could be implemented for the water trucks and, limiting the hours of operation. I think if we say, hey, no water hauling at night, that could cut down a lot of this kind of activity that we're seeing in some places around the county. And so I think that we'd probably be well served to continue meeting with code enforcement, law enforcement, county council, and try to figure out the best way forward.
All right, thank you. Supervisor Mulhern.
Thank you, Chair. I'm wondering if the log could include that the water hauler would need to list the cannabis operator's permit number. And that would be a really quick indicator of whether or not they should be hauling to that cannabis operator. I know that it's a challenge. For instance, if I was a water hauler and I'm being called to deliver water, if the county's requiring that I must get a permit number, that's a different conversation than me, Mo, the water hauler, asking somebody if they're legal or not, if that makes sense to you all. And I also would like to say that I support limiting the hours to daytime water hauling.
Okay, thanks, Supervisor Mulhern. Supervisor McGordy.
Yeah, so I think this is probably the most productive conversation we're going to have on this, is to try to get a little bit more information and clarity. So if I understand this right, we're saying that anybody who sells water should have a county business license. Is that correct? If they have a well and they're selling water?
Well, if we have licensed businesses, we have a way to revoke the license, the permit.
Mm-hmm.
And if you don't have that step, what do you do when you find out somebody's running water at night? You're going to send Matt down there to write them a ticket for $50 a water, right? I don't think that's there has to be some teeth in this plan. It can't just be the board says you better not do this. Maybe the board says if you do this against the rules, you lose your right to operate the business.
Well, and what makes it a little bit confusing, I'll just throw this out here, is because I know that there are also ranchers and people in agriculture who do their own hauling for different reasons, for water, for livestock. And I certainly wouldn't expect them to have a business license, and they may be hauling to different locations because typically cattle people run multiple ranches. So, and I know things are getting really desperate. A lot of my neighbors with cattle around here are finding that their springs are drying up, so they're having to make other arrangements for water. So, how do we handle that? I guess is what
Commercial ranchers must have a business license today. Maybe not specifically for hauling water, but for their overall operation.
They typically don't have a license per se. No.
Okay. Sheriff Kendall, did you want to add something at this time?
Just that a lot of the ranchers that I know understand that ag water can't be moved from one property to another via water truck. However, when it comes down to keeping livestock tanks full and things like that, Lord knows we're never going to stand in the way of that. It comes back to the same issues that we're facing in Mendocino. People need to make a living. And so we can't have a draconian approach to this. And I agree with Supervisor Williams. He's brought up some excellent points, as well as Supervisor McGordy. We've got to support the public while you know, getting into the nitty gritty when it comes to the illegal stuff. And we just have to continue working hard to recruit people and retain people so that we can actually get in front of this. I think that we are getting some support from the state. They're talking about it now. It's you know, it's been moving slowly, but it is coming. And so I'm certain that we will get through this, but we can't put good, hardworking people at risk while we do it. Thank you.
So looking to the Drought Task Force for some thoughts on, based on the feedback they've heard today from the other board members and county staff, any additional thoughts at this point? Supervisor Hashak.
Well, it seems like we have agreement that we could limit the hours that water trucks are hauling water to daylight hours, and that we could require a detailed accounting of where water deliveries are going. And I think that that's a conversation we need to have the ad hoc work with law enforcement, code enforcement, and county council to work out the details on.
I would second that, but for clarification, John, could we exclude livestock from this water hauling curfew? I think I'm with the sheriff. I don't want to make an outlaw out of a rancher who sees he has some cattle that are thirsty, and you know, it's past 7 o'clock, so he can't move the water.
No, that's certainly, you know, not our intent at all. So we will consider that, and certainly if it's on one piece of property, there's no problem with that. So
even if it's between properties, if the animals need water, I think we can't micromanage the ranchers. I think the intent here is you want to limit the hours for which outlaw cannabis cultivators can haul water to their illegal operations.
Right.
Well, I think we'd like to do more than just curtail the hours. We'd like to curtail the whole thing, period, that you can't haul water for illegal cannabis operations. I think starting with the hours is good, starting with making people who sell water have a business license is good. I think having people who truck water have a business license is good. And I think that having a logbook, and as Supervisor Mulhern suggested, if they deliver to a cannabis grow, they have to give their permit number from the county so that we know it's legit. So I think all those things are good. It kind of puts people on notice that A, we're watching, and B, we're trying to do something to get this under control.
So I support this. One more edge case I'd like to discuss. When I looked at the list of licensed haulers for potable water in Mendocino County, it became apparent that there's a lot of water hauling for domestic use that may not technically be following the letter of the law, meaning these water trucks maybe aren't certified, maybe they're filling up in somebody's backyard off of a well. In these drought conditions, the last thing I want to do is shut down water to people who need domestic water, no matter whether it's perfectly licensed with the state. How would we avoid impeding that flow of water? Because if we start requiring that people document how they're following the law, we may find that in an unanticipated consequence is we shut down people who are part of the solution.
Yeah, I share your concerns.
Supervisor Hashak?
Yeah, I think that's a legitimate concern too, is that there are lots of people who require residential water that we don't want to infringe on that ability to get that water. So that's all part of what we need to work out.
Okay, so we had the beginnings of a motion for direction for the ad hoc to continue working with county staff. Supervisor Hashak, would you like to restate that?
Well, I think the motion would be that the ad hoc continue working with
Excuse me, this is Alice Pearson, Deputy Clerk of the Board. We have not yet called for public comment for this item.
Okay, thank you, Alice. Do we have public comment on this item?
Yes, we do. 1 minute, please.
Just quick update. We do have a caller calling in right now. He had reached out to us, so he's calling in this minute.
This is Deputy Clerk Lindsay Doherty. The caller is having technical difficulty getting in, but we are working with him and want him to be able to join the meeting. You can begin speaking whenever you're ready.
Okay. All right. Good morning, Supervisors. This is Jim Shields, District Manager for the Lakeville County Water District. And by the way, you're on the right track, and our district would be more than happy to work with you on some of the things you've been talking about. Especially with the driver's logs. We already have that system in place. Daylight operations, we already do that. And we also have a estimated use of water deliveries for all of our customers, whether they're growers or not. And as John was saying, that there's really multiple uses for almost all of our customers as far as the use that they're putting our water to. Anyway, as I said, we'll be more than happy to work with the Drought Committee. The Lakeville County Water District disagrees with the county's approach regarding the proposed urgency ordinance because it is overbroad and reaches into areas of legitimate governing authority of local government, municipal water utilities. we believe that entities currently providing water for truck delivery should be divided or bifurcated into two separate categories providing such services. One, public water agencies, and two, private parties. The former are all permitted and regulated under the authority of the State Water Resources Control Board, while the latter are not under the control or regulated by any governmental entity. As a matter of public policy and good government, the determination of whether or not to impose prohibitions on hauling from one source to another, except for health and human safety of permitted businesses, that's really best left to the discretion of municipal water agencies with their elected boards that are responsible to their respective electorate. I have some familiarity with the rules, regulations, ordinances of the primary water agencies in this county that provide water for delivery by truck. Some of the common provisions found in these ordinances, including ours, would be water quality control measures, metered usage, the authority to restrict, prohibit deliveries to certain areas, the authority to prohibit water deliveries on specified roads or over specified bridges, truck operator codes of conduct, truck operator discipline procedures, truck operator revocation procedures, and public complaint investigation procedures. Public agency water sources and operations are by law approved, permitted, regularly inspected by the State Water Board and other governmental agencies. Needless to say, private party water sources, operations, and water truck deliveries are under few, if any, governmental controls or regulations. It is commonly known that private party water truck deliveries have for some time been problematical and caused legitimate concerns by county residents because of the nearly total lack of government oversight. It's also established fact, according to reports of resource agencies and law enforcement, that for these deliveries sometimes are illegally taken from sources throughout our county. The Lakeville County Water District recommends that the Board of Supervisors, 1, continue to allow public water agencies to determine the scope of water hauling operations, including any prohibitions on water hauling. 2, prepare an ordinance that would address a private well permitting process for the commercial sale of water for truck deliveries. This permitting process should also require hydrological testing for impacts on nearby water sources as well. And 3,
I do have a question for Mr. Shields, because I do think he's one of the most knowledgeable people in the county about well water and groundwater sources. He was just raising a point about a future permitting program that the county could implement for what are now private wells that are selling water. Could you just elaborate a little more on that point?
Okay. What we're recommending, Chairman, is that the county prepare and hopefully approve an actual ordinance that covers that area. One of the major concerns that we have, and it comes from numerous complaints of people who live in the greater Lakeville area, is that wells that are still operable during this drought, they have been privately selling and or providing water, but mostly for cannabis sites. But the surrounding neighbors have all registered varying degrees of concern about either their wells going into very low production and or their wells have actually gone dry. I work with a group down in Willits, down in Little Lake Valley. John Paschek's familiar with them. Same sorts of complaints coming from them. So I think this is really something that the county needs to get on top of. It's absolutely necessary to do real water tests and hydrological testing for the adverse impacts on surrounding neighbors.
Okay, thank you for the added information. Do we have any other members of the public wishing to comment on this item?
No, that concludes public comment for this item.
Okay, thanks. Supervisor Hashak.
Well, I'll make a motion to for the drought ad hoc to continue working with county council, law and code enforcement to come up with urgency ordinance that would deal with hours of operation for water hauling, driver logs or manifest, and also look into what can be done about private wells and the regulation. in this time of drought emergency.
Second.
Okay, we have a motion and a second. Any comment on the motion?
So again, is just for clarification, is illegal cannabis our main concern here, John? Or do you think it's any water use period?
No, I think the illegal cannabis has certainly brought this to the forefront, and that's what people are concerned about in our county. And I think it's an issue, especially during this drought, that we need to be more proactive on. And like Jim Shields said, we need to look at what the issue is with private wells and selling that and where it's going. And so, we're all hearing those complaints.
Okay, we have a motion. Can we have a roll call?
Supervisor McGordy,
Yes.
Supervisor Hashak,
Yes.
Chair Jardy,
Yes.
Supervisor Mulhern,
Yes.
Supervisor Williams.
Yes.
Motion carries unanimously.
Okay, thanks. As to 6A, my understanding was that DOT Director Howard DeShield and others were working on providing supplemental fiscal information. I'm just looking to them. Do they feel that they've had enough time to develop some additional information for 6A?
Chair Jardy, the finance team is still reviewing the numbers. They will be ready to finalize 6A for you with those numbers after lunch. However, we could go to agenda item 5B because Director Dashiell is available along with GSA Director Janelle Rawl. So if the board chooses, you could go to 5B and then we could take up 6A right after lunch.
All right, thanks for the feedback. Okay, so then we will go to 5B, which is discussion possible action, including approval of an agreement providing for emergency assistance among the County of Mendocino, City of Ukiah, City of Fort Bragg, and other signatory cities or special districts. And this is being brought back to us by Howard DeShield and perhaps General Services Director Janelle Rao.
Yes, good morning, Mr. Chair, ladies and gentlemen of the board. Howard DeShield, your Director of Transportation. I would also say key to this conversation would be Deputy County Counsel Matt Kordrowski. And if he's not been added as a panelist, I'd ask that he do that. And this is the item, correct, discussing the mutual aid agreement. That has a tentative agreement with the City of Ukiah, City of Fort Bragg, and as the motion states, it's scalable. Other cities or districts could enter into the mutual aid agreement. The mutual aid agreement, from my perspective, does allow for monies by each agency to exchange dependent on the aid given. And germane to your other conversation that's coming back after lunch, the City of Fort Bragg would have the capacity to collect on behalf of the county under this mutual aid agreement whatever portion of the hauling costs from Ukiah to Fort Bragg this board decides on later today, and then rebate that back to the county. So they're a key partner in many ways, not only continuing to deliver water to the citizens in the unincorporated area through their water treatment system and distribution system, but they've also offered, at least the city manager has, to assist the board in implementing whatever policy you come to later today. With that, I'll ask Deputy County Counsel Kordrowski if he'd like to add anything.
So Deputy County Counsel Matthew Kordrowski. I mainly wanted to follow up. We had a version posted last week, and if there are questions about the mutual aid agreement, please, board members, let me know. It is a skeleton to allow for this request of assistance and back and forth And that's idealized to be more specifically done as each emergency does occur. There was a slightly revised version that was posted to this morning to this agenda item. I pulled this on Friday afternoon from the City of Fort Bragg's website. I believe they heard this item last night. And I just wanted to note there are only minor changes compared to what was posted for the board's original agenda packet last week. Just briefly, there are 3 separate things that are highlighted in the PDF with date 8/27. Yeah, that's attached to this board item. On page 3 in paragraph 3.1.1, there is an additional phrase about the records of expenditures, including time cards and logs documenting equipment hours. I believe there is on page 5 in section 6.2, the word extent was added to that line. I believe that was an omission. And lastly, just as the name of the city attorney of the City of Fort Bragg was added to the signature block. So because there were some alterations, I wanted to call those out to the board.
Okay, thank you for bringing that to the attention of anyone watching the meeting. Supervisor Hashak.
Thank you, Chair Jordy. I'd just like to thank the people who worked on this, Josh Metz, Howard DeShiel, Matt Kudrowski, because this is a crucial component of making this water transfer happen. And without it, it won't happen. So this is really an important deal. And I look forward to having the other cities and other jurisdictions who want to join this in the future come along.
Okay, thank you. Supervisor McGordy.
I just echo that. This came together fairly quick, and thanks to Matt and Kudrowski and his team for responding quickly. This has been pretty speedy by county government standards to get this in place, and we were recognizing the urgency, and also thanks for Howard and Josh and everybody else who's worked on this, and Darcy Antle, Janelle. This is a slow creeping kind of emergency in a way, but it's a disaster nonetheless, and I'm glad we're able to play a part. It's frustrating in a way that we can't have a better resolution, but for now, at least this will work. So I think that's really important.
Okay, thank you. Supervisor Williams.
And thank you, cities, for caring about the health and safety of all county residents.
Absolutely. Do we have any members of the public wishing to comment on this agenda item?
Yes, we do. First on the line will be John Dixon, followed by Samir Tuma.
John, you can press *6 to unmute yourself. Okay, so we're going to move on to Samir Tuma.
Good morning. This is Samir Tuma. I spoke on the previous item, and I know you guys have a heavy agenda, so I won't take up additional time here. I'm just listening in and hopeful we're able to come to a agreeable resolution. Thanks very much for your time.
Mr. Dixon, you can begin speaking when you're ready.
You can press *6 to unmute yourself on the phone.
Thank you. Okay, can you hear me now?
Yes, we can.
All right, thank you, Chair and board and staff. Appreciate the opportunity to speak. I'm going to plan to use less than the 3 minutes allotted here. And there was a couple different water topics on the agenda today, so I think I had my name in the wrong slot. But this is related. My comments are related to the supplement or the subsidy rather of the long haul costs for businesses. That was the other topic. And if I can just use this opportunity to weigh in a little bit. First of all, I have been involved with the supervisors since way back when the Mendocino County Tourism Commission was started, and I feel like the communication and work together with the county, with the lodging businesses, continues to this day, and it sort of started back then. It feels like really working together closely, so we appreciate that very much. Dan Jurdy was involved, and former Supervisor McCowan, and here we are today, working together again. So we appreciate that. I think the important point that hasn't been spoken about that I wanted to make was that 20% of our business happens in the next 2 months. So we're still in high season, September and October. The second thing is anybody who might be needing to buy water in the next 2 months will likely be doing it for the first time. That would be true in my case. I own 3 small inns, so 3 10-room inns in Little River, and we've never had to buy water before. This year we did, but it was due to a leak. But in the meantime, we're sort of limping along by, conserving. But who's to say what tomorrow brings, next week, next month? And that's why I wanted to speak up for folks in my position as well, other small businesses, who would be buying for the very first time. We don't know what we're going to need. And I think this is unprecedented, is what I'm saying. And any kind of help that we can have, if we need it, is appreciated. So the request is to have as much subsidy as possible, at least even in the first month, and then it can be tracked, because I know that's something that's being discussed. I will say that any water that we have to buy, whether it's $400, $600, $800, or $1,200, is more than it is budgeted. If I have to buy water in our case, it's something that we, again, never had to do before. So as much help as we can have is appreciated as you make those decisions. And that's really all that I wanted to say. We appreciate, again, all your time and everything that you're doing. We continue to work, look forward to continuing to work with you on this, as well as everything else from COVID to anything else we can work together with. Thank you.
And now we have 2 voicemails.
I just want to say thank you so very, very much for approving a resolution implementing a water hauling assistance program. It just means the world to all of us here on the coast. We're very, very grateful for your good guidance and counsel and help. Thank you for the comfort you have provided. All good things to all of you. Bye-bye.
We are next
Hi,
on
my
line.
name is Jason Augustine here. I am a water technician in the North County here, based out of Laytonville. I am calling in regards to item 6B. I have spoken with Hashak personally as being holding data for having boots on the ground in and around our community. I have now spec 30 plus wells that will produce less than 100 gallons a day, not enough for life water, period. I really don't understand what the enforcement is going to be for these clients that have had tank installed, paid for, and now rely on bulk water to do their laundry, wash their clothes, eat food, blah, blah, blah. I'm amazed that we're trying to delineate bulk hauling right now. What will these 30 plus clients that I have need to do if this were to move forward if they needed water tomorrow? lot of these clients are elderly and can't afford another well on their property. Please think before we vote on this. It's not just weeds you're going to cancel out. There's a lot of people who will be banging at your door, filing suits if they cannot get water to their property. Little jumbled.
And that concludes public comment for this item.
Okay, going back to the board, would someone like to make a motion?
I'll move acceptance of this mutual aid agreement.
Second.
Okay, we've got a motion. Can we have a roll call?
Supervisor Hashak,
Yes.
Supervisor Williams,
Yes.
Chair Judy,
Yes.
Supervisor Mulhern,
Yes.
and Supervisor McGorty.
Yes.
The motion carries unanimously.
All right. Well, we're going to go to 6A after lunch. I think we may be at a point where we're going to need to go to our closed session lunch and come back to item 6A in the afternoon. So just checking with the clerk of the board, is that their understanding of how we ought to proceed?
Chair Judy, this is CEO Angelo. Yes, thank you. If we could take a break and go into closed session at noon for a closed session working lunch, that would be good. And then, as you said, when we come back, staff will be ready to finish item 6A for the board.
Okay, all right. So it's 11:46. We'll go into closed session at noon and come back out of closed session later this afternoon and finish up item 6A. Thanks.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic, we need to be kind to one another
And keep each other safe. By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me, yeah.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants,
which is what viruses tend to do when they spread.
Some variants are more contagious, while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us. We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
for our patients,
for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic, we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
Ya vet me aye.
我们能够做到.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
to see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love. I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients. For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
Your bet's me, yeah.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom, it was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
નમસ્તે, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients. For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom, it was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients. For our elders. For ourselves. For you. For us.
For our community.
Por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom, it was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community, not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom, it was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
नमस्ते, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year.
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
You bet me I.
Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso.
Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
या ये है all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives.
Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious,
while others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
This would set us back to where we were last year,
when we were worried that our hospitals would be overwhelmed,
when schools closed and children had to shelter in place,
and when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone,
especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible,
to save as many lives as we can.
Together, we can win this race.
For our patients, for our elders, for ourselves, for you, for us,
for our community,
por nuestra comunidad. Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year. I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community. Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County. The beauty of this place is reflected.
Going back into open session, and item 9A was not discussed in closed session. Items 9B, 9C, 9D, and 9E were discussed, and direction was given to staff. And we're going to go back to item 6A, which is the Drought Task Force item regarding subsidy for hauling water long distance. Is Howard DeShield back in our meeting? Howard, I think maybe you and...
I'm sorry, yes, I'm here, Mr. Chair.
Okay, so I think you and the CEO's office were working up additional information regarding cost estimates. I see Sarah Pierce in the meeting. Do you have those cost estimates, Sarah?
Good afternoon, Board and CEO Angelo. Yes, I do, but I think Howard wanted to speak prior to me showing.
Yeah, Mr. Chair, Howard DeShield, Director of Transportation. So what I'll say is very general, and I think Sarah and Josh will be able to add specifics. But obviously, we know we have a situation where various residents around the county, mostly on the Central Coast right now, are able to go to a water purveyor, either the city of Fort Bragg or another water company that has water to sell, and they're able to hire a private potable water truck delivery to bring water to their residents or business. And because of the drought, prolonged drought, the cities and other water districts aren't able to have surplus water to make available. So this program of mutual aid, you approved a mutual aid agreement this morning, is going to allow the Ukiah for now, and perhaps other cities and purveyors in the future who sign on to mutual aid, to take water to, in this case, city of Fort Bragg for distribution in the normal manner, where people would hire a truck to bring a load of water to them. However, getting that water from Ukiah or other points to a point where it can be distributed, I think Josh was explaining, adds about 27 cents. I think I said it could be less than 27. It could be more than 27. It'll add some amount of money per gallon. And I believe the question before you, knowing that people will still have to pay the normal rate, to get water that we can make available by adding to Fort Bragg's supply, knowing that people would then have that available, they'd still have to pay the normal rate. But we think that this added cost to transfer the water all the way from Ukiah could about triple the rate folks would pay. So the idea is, how much of that tripling would the board consider subsidizing? And I'll let Sarah now share the more specific numbers.
Sarah Pierce, Principal Analyst within the Perm Department. I'm gonna go ahead and share my screen right now. Can you see the Excel file?
Yes.
Okay, so thank you for allowing us to present today. The presentation in front of you is outlining 3 scenarios, calculating the cost to haul water from the city of Ukiah to the city of Fort Bragg. Within each scenario, we are calculating a 5,000 gallon truck, a round trip time of 6 hours. The water cost per gallon is remaining the same at 3 cents per gallon. The remaining, or the targeted water volume will remain the same at 75 gallons per day, which equates to 15 trucks per day. The change in the calculation is all based on the different hourly rates for each of the truck calculations. So in this first scenario, we are assuming $175 per hour for the 5,000 gallon truck, which will be 6 hours round trip. And so that equates to the hauling cost of $1,050 or 21 cents per gallon. The total cost to haul water and for the hauling and for the water is $1,200 per truckload or 24 cents per gallon, which then equates to $540,000 per month in scenario 1. I'm going to go to scenario 2. As I said, everything else except for the hourly rate remains the same. So at $200 per hour, the trucking cost and water would be $1,350 per truck or 27 cents per gallon, which equates to $607,500 a month. And then scenario 3, if the hauling rate was $225 per hour, it would cause the hauling and the water to be $1,500 per truck or 30 cents per gallon, which then equates to $675,000 a month. Down below, we have it broken out on the percentages, as Josh was showing earlier, at 25% of the total demand being domestic and 75% being commercial. If we were to assume in each of the scenarios that the domestic would be subsidized at 100%, these are the costs based on the different hauling rates. If we were to assume 100% of the subsidy for commercial, it equates to the monthly amounts I just showed. If we jump down and change the subsidy to 80% for commercial, it reduces the commercial to $459,000 if it was $175 per hour, $516,375 if it was $200 per hour, or $573,750 if it was $225 per hour. I know that's a lot of data. I don't know if you want to let me to pause there. The next scenario I had was the same, but at 75%.
Sarah, is that the last example you have? Is it 70%?
It is.
Okay.
I can change any of these different percentages and update the calculations, but this was our starting point.
Okay. Supervisor McGordy?
So I'm curious, Howard, I was thinking originally that we'd be able to find trucks that were could haul 6,500 gallons at a time? And I'm also curious about your hourly rates, how you're getting those.
So Supervisor McGorty, if I can, through the chair, Howard DeShield, Director of Transportation. Yes, you're right. The 40-foot semi truck trailers will haul 6,500. We're trying to get such a truck. I think we were trying to, with these scenarios, just produce something to compare, to give the board an idea of why so much money has to go into getting this water from Ukiah to Fort Bragg, and then to show if the board subsidized that, how it would change the end cost to the user. So I guess the answer to that is it's just a scenario for comparison.
Okay, so and it's it's a conservative scenario, which is probably good, so that we're likely to be able to meet these targets if this is indeed what we end up with.
Hopefully.
GSA Director Janelle Rao.
Through the chair, Janelle Rao, General Services Director. So just to add on to what Director DeShield was mentioning, these are just scenarios. So the gallons per truck, yes, could change, shift. We are hoping to get the 6,500 gallons, as will the numbers shift depending upon the volume that can be hauled. So these were pivot points for you to consider. The idea here is to get the policy direction based on the percentage of subsidy based on these formulas. Now, as we drill down and get at least one quote, we're still waiting for the one to come in. We'll be able to get you some real pinpointed numbers once we have that data.
I might add, Director Shield here again, we've been trying to get that one quote since about last Wednesday. So it's not like we haven't been trying.
And I have another question too, and I know at some point this has come up in the task force, but we're taking potable water and we're shipping it in water trucks, and even though it's going to be retreated, is there any reason why we can't go to a food grade truck that's not certified for water hauling?
So Howard DeShield again through the chair. We asked that question. That was one of the early questions we wondered about. And there is a procedure laid out that a truck could be certified, and the regulatory bodies are willing to do that. We actually posted that procedure, at the county website, but it's quite rigorous, and I think that the water purveyors are very concerned that they can give assurances to the quality of their water and that no pollutant could enter it. So yes, there is a way to do that, but it's not easy. And that's why these already pre-certified, trucks on the list are what we're going for right now.
And are they strictly water, or are they food grade and or water?
These are the potable water trucks on the list. There is a way to take a food grade truck for this project and sponsor a waiver for it, but it's not easy. It requires some rinsing, then testing after so many hours. And I don't know that a lot of the truckers out there look at that and think it's worth it. So obviously not some of them might for the second phase where we're trying to go the competitive bid. But again, we did start working on this right after last Tuesday's meeting. So we've been putting it together quickly.
Okay, thank you.
All right, Supervisor Williams.
How many dump trucks does the county own?
Oh, wow. We've probably got 10 or 12.
Can we just put a tank in the back of the dump truck?
Well, Supervisor Williams, the county also has 6 or 8 regular construction grade 10-wheeler water trucks, but those are even less acceptable. I mean, a lot of truckers have called me saying, hey, if you're going to treat the water anyway, why not just take it over as raw water? And again, the water purveyor, in this case, City of Fort Bragg, that is responsible for the treatment, and the regulatory agencies that oversee that are not going to take any chances with any kind of serious pollutant entering their water stream. And frankly, if I was in their position, I wouldn't either.
I understand. I was getting at, could we use a CDPH approved tank on a dump truck?
I would rather do what you asked me to do this morning. We're right now looking for a potable water tank that we could rent, tank and trailer, that we could hook to our one tractor. The department has one tractor, and see if we could lease something like that. But I don't know that you're going to find potable water tanks out there that you can throw in the back of a dump truck and have that meet state standards.
Okay, so I think the issue before us right now is not the logistics, but the cost share. So if we could focus on the cost share a little bit, what's the comfort level of the board knowing that we are hoping in about 4 weeks to know the results of the county's grant application with the state? So I think we're likely looking at the first 4 weeks being carried by the county. And then we'll see if the state picks up any or all of this program in about 4 weeks. Supervisor McGordy?
So what I propose is that we kind of stick with what are kind of the accepted prices for our residential loads, and then for the commercial people, maybe an additional $200. So like 400, 600 would be something I think that would at least initially supply people with water. And I realize it's going to be really hard for some people to afford that, but I don't know what else to do.
Okay, based on the chart we saw earlier today, that was looking at the 80% cost share by the county.
Yes.
So I think we should do that certainly for the first 4 weeks. I think during that time we could look at other funding options as a backup if the state does not pick up the commercial side. To see if, I'll bring it up again. I think if the state doesn't pick up the commercial side and this drought continues, I think after the first 4 weeks or 5 weeks, whenever we learn from the state, we could look at a cost share with our promotional dollars. I don't think we're having great success getting tourists coming to the coast. People are reluctant to get on planes and travel long distance. They're looking for road trips. They're coming to Mendocino County. And I think we could have a cost share with the promotion budget that we have after the 4 or 5 weeks. Supervisor Hatchak.
Well, I would agree with that. 80% seems very generous on the county's part to the commercial side. But I could go for it for the first 4 weeks and recalibrate as needed. I think that using the promotional budget is a wise thing to do. And so I would second Supervisor McGordy's motion.
Okay. Supervisor Mulhern?
Thank you, Mr. Chair. I'm wondering if this proposal would then be reconsidered after the first month and we find out how many people actually purchase the water and how the whole scenario actually works out.
I think we could consider this even sooner, in 2 weeks. After 2 weeks into the program, with people going, wow, this just isn't working. I think we need to be watching this really, really closely.
Yeah, I agree. I think it needs to come back, and if there's some new information in 2 weeks, that'd be great if we can get it on the agenda. Otherwise, we definitely want to have this on our agenda as soon as we hear with what's happening with the state grant application. Alice, did you capture that as a motion from Supervisor McGorty and seconded by Supervisor Hashak?
No, I'm gonna need that restated clearly for the record, please.
Okay, so I propose that we subsidize our commercial water at 80% of the haul cost and residential water at 100% of the haul cost, hopefully with resulting in a retail cost to customers of $600 for commercial and $400 for residential.
And that this would be revisited as soon as possible.
Yes.
So this is Director DeShield, if I could, Mr. Chair, for the record. We can do the thing about 100% of the haul costs for residential, not covering that, and 80%. The part about that, hopefully it results in a $400, $600 retail price. That's just really loaded because every delivery has a different distance it goes. Even the delivery trucks might have slightly different volume. It would just be really good for me if it was clear that the controlling part of this motion were 100% for residential and 80% for commercial. The percents help us at a staff level determine how we're going to apply the subsidy in a much clearer way.
I would amend my motion to that we would want to make a motion that we will subsidize residential hauling for residential water 100% and hauling for commercial purposes are at 80%. To be reviewed and often.
And I'll second.
Okay, and for clarification, the hauling subsidy is for the long haul portion.
Correct.
Okay, Atlas, do you have the motion?
So I'm gonna let you know what I captured. There was a little bit that Supervisor McGorty added at the end there that I don't have incorporated. So if that's wanted, we need to add it. I have subsidized commercial water at 80% of haul cost and residential water at 100% of haul cost. What we didn't capture is that portion about wanting it to come back or how that works.
Yes, we should review it within 2 weeks after, or to be reviewed every 2 weeks.
So this is Atlas Pearson, Deputy Clerk of the Board. Our September 14th meeting is over allocated as it is, like beyond over allocated. I don't see this having time until the end of September at the earliest, as far as a regular item on a board agenda goes.
Supervisor Hashak?
This is a question for Atlas. Is there a drought task force report on the 14th?
Let me take a moment to look at forecasting. I don't have it in front of me right this moment. Give me about 45 seconds.
Working on it.
Because it seems like this could just be incorporated into the task force report.
I think we can find, if I might, General Services, we can definitely find a way to get the information back to the board, whether it's through the drought ad hoc or even through the CEO report. Either way, we will make sure that we keep the board informed. We will even keep you informed as we do identify the hauler and what those costs happen to be. Even if it's not in the public setting necessarily, we will make it to the public setting, but we will for sure keep the board informed.
Okay, that's acceptable.
Okay, so we have a motion. I think it's been captured. Can we have a roll call?
So I want to make it really clear this direction to staff portion. I currently have and direct staff to return with an update within blank. So do you want it by way of a board item? If so, we're trying right now to get into forecasting, or if you want to do it in some other fashion. We just really need to nail it down before we vote.
Well, can we say it's on the September 14th meeting? Do we have to specify beyond that?
The issue is that we don't have any time on the September 14th meeting. We're already over allocated by like 2 hours that day. So when I say there's no time, like I really mean there's no time. We do have a meeting on the 27th of September. I know that's slightly further out than you wanted, but that is the soonest time that we have available on a Board of Supervisors agenda for a discussion of this caliber.
If I might just offer up again, perhaps it can just be that staff will update the board on the 14th agenda, whether it be a consent update through the drought ad hoc, or via the CEO report, if that's sufficient. Doesn't have to be a standalone regular item.
Yeah, I think that's sufficient for the update. There's only going to be a limited amount of new information in 2 weeks anyway, as long as we have an agenda item where we could take action on the 27th. I think that'll work. Okay, can we have a roll call?
Supervisor Mulhern?
Yes.
Supervisor Hashak?
Yes.
Jerdy?
Yes.
Supervisor McGordy?
Yes.
Supervisor Williams?
Yes.
Motion carries unanimously.
All right, well, thanks. And that takes us to item 5C, which is discussion of possible action, including acceptance of the presentation of the introduction of Mendocino County Parks Needs Assessment, Phase 2 by Blue Point Planning, and provide direction to the consultant for completion of the assessment. And the sponsor of this is General Services, Janelle Rao.
Good afternoon, board members. Janelle Rao, General Services. So before you have an informational update. We are not necessarily looking for board direction, but do want to discuss with the board not only the prior Phase 1 Parks Needs Assessment, but also what the intent is for the Phase 2 of the Parks Needs Assessment. With us on this presentation, we have Mindy Craig from Blue Point Planning. She is with our consultant that is conducting the needs assessment. Excuse me, Gail Donaldson, who's also with Gates and Associates and also is a consultant. We do have Deb Fader Sampson. I'm hoping I'm pronouncing her name right, who is with the Cultural Services Agency. I should also have with me Kyra Pierce from the Central Services Agency, and then we also have Dan Mazzani, our Facilities and Fleet Division Manager. I do also want to recognize that a lot of work went into this under the Cultural Services Agency, and just recently with the formation or reconsolidation of some of the centralized services or the general services of the county, the Parks Administration was something that was looked at due to the activity surrounding the Parks Needs Assessment. The Phase 1 assessment did identify a lot of information about the parks. Within Phase 2, we are really looking to drill down into the potential capitalized needs and the risks associated with not necessarily addressing those capitalized needs. The purpose of this really is to give the board some tools for planning. I would see this as anticipating you using this in your toolbox, so to say, or your kit when you're doing your strategic planning. The eventual outcome and some of the decisions that we will likely be looking or placing before the board will be including the operational, continued operation of these parks and the costs associated with that, potential concessioning or outsourcing of parks or various parks programs and operations, or perhaps even considering decommissioning some of the parks. So with that, I'm going to go ahead and turn it over to Mindy, And we'll go through the presentation. And of course, if there's any questions the board has, we're here to answer them.
Great, thank you, Janelle. Thank you all. It's nice to see some of you, and I know some people are new since I was last here before the pandemic started. But this will be a chance for us to do a brief overview of what we did in phase 2. And as Janelle mentioned, we will go into some of the details about some of the trade-offs and the thought process that we are going to employ in this next phase to hopefully give you guys, as you said, a really good understanding of what your choices are and how you can proceed most effectively. So let me go ahead and I'll share my screen. And if there is a question in the middle when I'm talking, obviously let me know, but we have some time at the end to have some questions. So I'll just briefly do this as already covered. So we're going to provide that overview of the needs assessment, give us some of the direction for that. We would like to get some direction on the phase 2 recommendations. You know, is there an area that is more important to you or not? Consider and discuss the different approaches to moving forward. So we recognize that there's a lot of costs involved here. There's a lot of deferred maintenance and challenges with some of these parks, and we'll go into that. But you know, is it something that the county wants to continue to maintain, operate, and manage all the parks at a high level? Are we going to outsource some of these things? Are we going to divest on some of these parks? Those are some of the questions that we've been asking and wondering about as we go through this. So this is a brief overview of what we've done. We started in 2017. We did community engagement. We did things online. We also did meetings with individuals and stakeholders throughout the process. We visited all the parks. We mapped all the parks. We created a detailed inventory, looked at demographics, trends. We looked at benchmarking of local and similar counties to Mendocino. We did some national analysis in terms of like where we are in terms of our cost and spending, and developed that needs assessment report that is available. And we've been sharing that with the community members online on our website. And again, this one now is where we really want to dig in and say, okay, we know what our needs are. How are we actually going to move forward to solve that? And what are the costs and possibilities to do that? So just as we know, there's 6 major parks that equal about 583 acres. There's also 3 unimproved access areas, and those are very varying sizes. They don't kind of reach the full concept of a park, but they are something that you have to manage and deal with. Those are the sort of dark brown ones here. We have 3 community parks, and a community park is sort of a large scale park that have multiple different elements in it: dog parks, picnic areas, ball fields, playgrounds. And then the really, really big parks, Mill Creek, Faulkner Park, which are more trails, natural areas, camping, picnic areas, and swimming like at Mill Creek. I mentioned that we did comparables to other counties. So we looked at 5 other counties that had similar populations and similar kinds of sizes. So that would be Tehama, Lake, Tuolumne, Yuba, and Humboldt. And sort of the bottom line here is there's a lot of variations in terms of the size of how many parks everybody has. But if we look at the budget to the revenues and the budget we have allocated for parks per acre, Mendocino is less than half of what, say, Tehama is. It's less than Yuba even in terms of what is being spent on the maintenance and management and programming for those parks. So pretty much start off the baseline is that we are not dedicating much to the parks, and it has been a bit of a challenge as it's moved from different locations. We did with the department, when it was the Cultural Services Agency, an analysis using NRPA, which is the National Recreation and Parks Association risk assessment about how the department's operating or how the parks are being operated, about the amount of maintenance and capabilities and staffing available. And based on these metrics and what we look at across the country, we have a very high risk in terms of sort of just what our future looks like. So too increased fire and safety issues because of remote parks and illegal fires, low level of maintenance and staffing to support those parks, We're not really able to effectively collect fees for rentals, events, and day use. Our garbage and bathrooms are not being maintained. We haven't been able to do the physical upgrades and replace the failing equipment. So there's some big, big challenges that were identified around these parks. I mentioned briefly that we have done a number of outreach engagement efforts. So we did an online survey, we did several community meetings throughout the entire county. We had the website up and continue to have that and collect comments from the community. Utilize the library bookmobile outreach throughout the county to share and bring people into the mix, and then continue to have announcements of outreach activities on the city websites and Facebook pages. And in those community meetings, we've also met specifically with stakeholders, be it from BLM to parks groups in Gualala or other interested stakeholders who are very deeply invested in these parks. So I'm just going to briefly go over the parks assessment and by the major parks here. So Bower Park's beautiful park, lots of space, with great opportunities to make it really unique and special. It's very important for the community. It's used very heavily by them, but there are a lot of dying trees and poor maintenance. Facilities are in disrepair, and there's a lot of hardscape that are cracking, and there's potential safety issues. There's an old building there that is really falling to pieces right now and is a challenge. So generally, we recommend that this whole park should be renovated, including potentially some of the reorganizing of activities to work it better. So having a master plan for the park. We do see this opportunity of actually creating some more revenues through the picnic areas and also sharing through the community. It really is the only community park in this entire quadrant of the county. And so those neighbors are very invested. And that was something we heard over and over again, which I think is a very positive thing, is that you have stakeholders and residents who are willing to jump in to help in some way in managing these parks, but we need to have a mechanism to do that. Faulkner Park, also this incredibly beautiful redwood park with flowers and really unique botanicals, but it's out of the way unless you're in Boonville. And as we know, there are lots of tourists are going into Boonville. There are schools, there are people who use that as going from one side of the county to the other. Some of the big concerns we have are how can the county effectively maintain the park? Right now, it's not really maintained except for by some neighborhood groups. So there are potential fire hazards, overgrown vegetation. The trails are really underutilized. The picnic areas are in very poor repair, and the trails are very mixed, even though the community members have been trying to do that. They've built up a lot of little bridges as shown in one of those pictures on the far right hand. So there are, again, some opportunities to look at some revenue potential and to sort of pay for some of that maintenance through maybe allowing an overnight group camping with only reservations, or maybe summer camps. So you would have something with there'd be oversight kind of built into it. There's also an opportunity, as we talked with our community neighbors and thought how this can be used for other things, which is establishing it as a refuge for firefighters in case of a fire in the area. So creating actually a paved parking area that fire trucks could stop, because that road is very long and there's very few places where they could actually stop. So this could actually be a place where they could muster groups of people and it would be a firefighting area. So potentially an opportunity to create some funding through resilience, CAL FIRE or something like that. So the Anderson Valley Fire and CAL FIRE are potential partners with that. Indian Creek Park is a beautiful car camping spot with swimming hole and nice trails. It has the highest revenue of all the parks, which is not a lot. It doesn't have a very good way to collect those fees, but if we could, I think we could generate even some more. There's a lot of erosion of the landscape from overuse and nobody really paying attention. The bathrooms aren't really adequate for camping, so that's a challenge. And there are some illegal fires that are a very major concern, particularly to some of the retail and commercial interests that are surrounding it. And then the fencing along the creek and along the property is in disrepair and pretty dangerous if someone was to trip and fall on that. So in this sense, we really recommend a way to maintain and monitor the park to reduce fire danger and improve our fee collection, do some physical improvements around stream access, nature signage, and add an actual bathroom to the park. And I'll just say quickly on the bathrooms, there's a lot of the parks have flush toilets, but we're recommending potentially moving to what the state parks do, which are very sort of nice pit toilets, different way of doing this, which might have a little bit lower cost and lower maintenance. Low Gap Park, obviously, it's right there in the middle of Ukiah. It's extremely well used, but there's a huge opportunity for enhancements to the amenities and reducing the impacts from use. So there's some facilities that need to be replaced or updated. There's an amphitheater that has been fenced off and has fallen to disrepair and you can't use it. There was an old picnic shelter for group picnics, and that's been gone. There's an old caretaker space, and the bridge there is unsafe and needs to be replaced. So that, along with ecological restoration and improvement of the trails, would go a long way. So we really would recommend focusing on improving group picnic areas and expanding opportunities for those picnics with the new restrooms, shades, and facilities. These also would be revenue generating and hope to offset some of the cost. And then working on enhancing the trails and restoring the creeks and habitats, and some Frisbee golf improvements as well. Mill Creek is the largest park you have in the system. Absolutely gorgeous, regional and a community asset. It's really well used for fishing and swimming, group picnics. There's trails with very big views. But because of the location, encouraged for late night partying and trash, there's quite a few safety issues on different parts of the dam, people kind of not paying attention. The porta potties are poorly maintained and the bathrooms are really dark and appealing. So there's a lot of lack of maintenance personnel for the picnic rentals. So that is a challenge. You know, we want to create some of that revenue, but we do need that maintenance there to make sure that they are robust and really nice spaces. So there's some ideas around how can we improve the erosion along one side of the lake, potentially a boardwalk of some point where it could also be accessible to anybody, better awareness and maintenance system, registration, adding bathrooms along the area for the dam, which is now just porta potties. And I think there's a lot of opportunities as in all these in some partnerships. BLM participated in some conversations with us and has crossed the road. And there's also they renamed themselves, so I can't remember it was a gun club that has renamed itself, but they are also very interested in maintaining and participating in this park. And then Lion Club Park is a very nice park that's very well maintained and used. It's a bit smaller space. There was bond money that helped more recently to update that. They had badly vandalized bathrooms and that was going to be fixed, so I don't think that's an issue. So here the recommendations are actually light, but we could add some more shade areas. Bring back, there's a dog park area that I know is challenging. That's one thought that people were saying, should we bring that back or not sure if that's what we want to do, but there's an opportunity for that. Opportunity for more individual picnic areas, and also maybe doing some transforming the 2 half-court basketballs into a full court. So I'm going to now transition quickly to the swimming hole access areas. There's the Mariposa swimming hole. It was located in a recent burn area, so it's close to neighbors. The fencing broken, it's pretty dangerous. So there's some basic improvements that need to be made, but whether or not you actually want to keep it open is a big question. We would recommend that you do not. The Key Parkway has kind of multiple spaces along the river. There's some big parking areas to allow communities members to go in and to use this, but the access is not great and it's kind of dangerous in some places. So just having better understanding how we want people to access this and making it official or not, we kind of need to decide how this park is going to live and be part of this effort. And then there's an access area at the Vichy Springs. It's a bridge just as outside of Ukiah. A lot of people use this to put in their kayaks. There's no amenities really here. It's pretty straightforward. So there are opportunities though for including improving trash collection. There have been historic locations for homeless encampments in this. So somehow making sure that this is either activated or managed in some way would be important. All right, so almost done with this assessment. So there's a major concern in establishing adequate funding and staffing for the maintenance and operations of the current parks and any future parks. So there was some discussion about we need more parks, particularly up in the northern part of the counties. There's a lot of work that needs to be done with staff, supporting events and rentals, doing physical upgrades, enhancements, the garbage and bathroom maintenance, fire safety issues. A lot of people say, oh, we need to have volunteers, but that includes, we need staffing to manage volunteers. So dedicated funding and people to manage the parks is a really important thing if we're going to keep using these. We need to get some kind of online reservation system so that we can collect the fees that are due to us and also just make it easier for users and really build up on those community partnerships. There's such a lot of opportunities for us to build on that. And then think about how we can strategically use our parks, especially the ones that are more remote, to manage our different resources, look at different ways to manage our bathrooms, as I mentioned, and also opportunities for more programs and community services. So there are a lot of needs and people do want to use the parks. And so if we can create those opportunities, I think they will be used. So now we're moving on to this phase 2. What we've done in preparation for this meeting is we took what we learned in phase 1 and we started to investigate at a very order of the magnitude high level, what are the different maintenance, operations, and capital improvement costs. We wanted to take this high level look first to talk with you so you can understand what we're thinking about and what this investment might be, so you can better give us some direction as we finish up this area. We didn't want to create work that wasn't going to be useful. So we're really trying to make sure that whatever comes out of this effort is going to be most useful for the county. So let me first go over some of the sort of what we're talking about, because there's a lot of different pieces and elements of cost and revenue. So one is the ongoing maintenance costs, and that we'll call the annual cost for basic upkeep and management of park cleanliness based on typical use. So those are the things that we're going to have day in, day out, no matter what. If you have the parks open, those need to be done. And they really have been sort of scattershot, again, because we have limited staffing and the parks are so far apart. Then we have capital costs, and those are the one-time costs for replacement of amenities, renovations, or additions. They could be obviously general fund, or they could be a grant funded or something else, a gift or donation. But those are the one-time costs. Operating costs are those that are costs for providing services and programs at the parks and facilities. So if we want to have a summer camp, if we want to have a nature program, and so forth, those are where the operating costs come in. And then we have revenue side. So rental revenue, so those are one-time fees for using facilities, a wedding, a picnic, or something like that. And then there's program and event revenues, so fees for classes or camps, which are can be very good revenue basis, or similar activity that can be an ongoing or one-time revenue. And then there's special use revenues. You right now have the Indian Creek campground, so that's a very similar one. Fishing boat fees or any other special activity that revenues make sense for, that would also be like that. We could imagine a private group renting out an area, say at Faulkner, for a special team building program. So there's things that we could imagine that could create revenues if we had the staff or people to manage those programs. So we took these again at an order of magnitude. So high level, what are we looking at here? So our recent costs. So we have our average revenue was around $24,000 in 2014, 2017. The average expenses were about $161,000. And this has changed, and we can say a snapshot at a different time, but that's generally what we're talking about. So this reflects less than one full-time employee for all of this effort, one maintenance staff. It is really related to limited ability to generate or collect revenues. There's no programming at the parks, and it's about that 50 to 75% less than other similar county park systems. Our ongoing annual maintenance costs. So that's what I just mentioned what we're paying right now. If we were to say, what should we be doing? We would go to a very different level. So we did some estimates, again, order of magnitude, and Gail Donaldson is on here, and if we have some questions, she can jump in. She did lots of these numbers. But so for the developed park, like a low gap, there's about a $5,000 per acre annual maintenance cost that we should plan. we should assume that it is about 1 full-time employee per 15 acres of developed land. So that would be about 2.5 full-time employees that we would need. And then we estimate about $500 an acre for those natural areas. For the Mill Creek, it's really large. There's maintenance, but it's a different level for that. So overall, we're thinking of an annual maintenance cost of around $500,000 for the parks that we have, including those access areas.
And I would just want to jump in and say that we looked at some of these larger parks in pieces. For example, Faulkner Park has an area that is a little bit more developed, but it has a certain amount of acreage that's just woodland with trails going through. So we put the maintenance costs for the underdeveloped parts or the natural areas. Those were based on a different set of criteria than what we use to estimate the annual maintenance on a developed area, like a playground or a picnic area or something like that.
Excellent. Thanks, Gail. And then we looked at the capital improvement costs. So when we went in the first phase, we did a very detailed inventory. We actually took photos of every single bench. We assessed all the different pieces from a picnic table to the bridges and so forth. So we identified where there were things that were going to be failure, how to be replaced, or so forth. So we then did an analysis of all those different amenities and identified if they're high, medium, or low priority. So the high priority ones were the ones that have a health and safety or serious infrastructure need. We had some medium priority ones with significant functionality improvements or potential revenue enhancements, or that preserved the asset so it wouldn't go further down and would cost more down the road. And then there were some low priorities, which were just deferred maintenance or minor improvements. These clearly need to be refined and work with the county. But I think this gives you, again, that order of magnitude. So when we think about this capital improvement cost, we have about 1.6 million on that high priority, a little under $1 million on the medium priority, and about 380,000 on the low priority level.
And on this chart, I would point out that some of the things are items that have already been either done or approved. For example, the Lions Club, 21,000 was what was in the county budget for repairing the bathrooms, and in Logat Park, there was 650,000 in bridge repair for a bridge that is in serious need of safety improvements. So some of those figures are including things that are still in the pipeline, or when in the case of Lions Club, something that actually was fixed.
Great, thank you, Gail, for reminding me of that. And then I think this is one of our last slides here, and we can jump into questions. So I wanted to talk a little bit about operation staffing considerations, about programs, rentals, and volunteer management. So there's a whole bunch of different models for operating recreation services, but we wanted to say, okay, how have other agencies of similar size done this, and what is the, how do we level out the different staffing? So for National Recreation Parks Association, again, this is the national association for all parks across the country. Typically, they have about 4.5 full-time employees per 10,000 residents. So that's what their benchmark is, and that's a lot of maintenance. As you can see, it's about 45% of those are maintenance staff, 34% or so are programming, and then there's about 16% administration. So right now, if we think about what Mendocino's been doing, we've really only been doing that 16% and the maintenance. So we haven't done any of the programming, and we have done not necessarily that level of maintenance. Programs, those classes or activities that you go back to the community, those can be done by the staff. It can also be done by a contractor. So the county could say, hey, we want to do summer camps. We think that would be a great thing for our community members. We don't want to hire people to do it. We're going to find ABC Camps R Us to run that, and they will use our facilities, and they will do all the work to have those summer camps, and they would pay the county some kind of a fee for use of that space based on those summer camps. Those are really important. Those programs are the way that you activate parks. So some of the areas that we see some challenges where there's nobody there, programs are a really important way to actually make the eyes on the park, make them safer, make them feel like they're really well used. So an important revenue source as well. I already mentioned some of the rentals, a little bit about what that looks like. You can have, again, a concessionaire, and something like Indian Creek. Some of the commercial folks around have actually said that they might be interested in working with the county on managing that campground, because again, they're worried about the fires, but also they see it essentially as an asset there in Boonville. But they also can say, hey, somebody wants to do weddings, or they want to do sports facilities. These are all different ways that, again, a concessionaire might be hired by the county to do the work, pay some of the funds to the city, or excuse me, to the county, and offer these opportunities. Typically picnic rentals, which are something that we do a lot of here in the county, are not included in another kind of source. Usually that is done by the county. And then finally, volunteers, again, which we have the opportunity for volunteers, but we really need somebody who is providing oversight of those volunteers, making sure they're doing what the county wants, that follows risk management protocols, and so forth. So, as we're going forward, some of the things we want to talk to you about are how you manage these parks. So, scenario A is that we invest and operate all the parks. That's the county's job. They say, okay, this is such an important thing to us, our constituents, that we're going to transform how we do this and really build into scenario A. Scenario B is saying, well, we're not going to be able to do that. Doesn't make sense. It's not feasible. So we're going to look at where we can contract, where we can partner, and potentially divest on one or two of these parks. And then finally, there is the scenario C, which is divest completely and say, we can't, as the county, it's not working. We're not going to do this. We're going to figure out how to do a divestment and sell it off, or have other people, nonprofits, manage these parks completely and wholly. And obviously there's iterations and hybrids of all these, but these are just sort of a spectrum for you to think about. So that's all I have right now. I know that was actually quite a lot of information, but want to open it up to questions and any discussion you might have. And I can stop sharing my screen, but I want to leave it in case you want me to go back to refer to slides. Janelle, let me know what you think I should do.
At this point, I think we'll just turn it over to the board for any questions, and if we need to, we can go to the slides. I don't know if the board has a preference, but let's start with questions, see if we need to refer back.
And maybe we could go to the slide that shows the map of the county that with all the parks.
Yeah.
Okay, because we may have some audience members who are not familiar with any of these parks, or only one or two of them.
Yeah.
Okay, who would like to go first? Supervisor Mulhorn.
Thank you. I participated as a constituent in the Parks Needs Assessment, and tried to help promote getting feedback for that, because I do believe that the parks are incredibly important, not only to our residents, but also to our visitors. So I also understand clearly that the county does not have capacity to manage these parks in a way that would be even more beneficial to our community. So I'm interested in hearing from my colleagues about some sort of hybrid potential for contracting out some of the programming, and also possibly some of the maintenance on the parks. Can I just add, in particular, I believe the coast has a specific parks district. So I'd like to hear your thoughts.
Yeah, I think it was around 1978. The city of Fort Bragg was maintaining a swimming pool that was part of City Hall, and the community created the Recreation Parks District. So since around 78, I think it was, a very, very small fraction of the property tax that has grown since then, has gone within the boundaries, has gone to the Mendocino Coast Recreation Park Districts. So anyone wants to comment about Supervisor Hashak?
Thank you, Chair Jurdy. One of the comments I got with the PG&E settlement funds was about the Mariposa swimming hole. And I know that that's it's a little swimming hole, but it's used by the community a lot when the time's right. And I just wonder, there was a recommendation to not even fund it at all. And so I was wondering what the reasoning for that was about, because it seemed like the letter for the PG&E funding was, hey, this is would lift the spirits of everyone, would provide a central focus. And so I was wondering about that. And I was also wondering if potential funding sources like a CSA3 model could be employed for some of these areas. So the people who would directly benefit from that area could be assessed something.
Would you like me to talk? I'll address the Mariposa swimming hole. I think the costs, access, and challenges of managing that piece of land was, and given all the other needs, was the primary reason we recommended removing, not doing that, because it is not in a very central location. It's in kind of a little neighborhood. Things like if we look at Mill Creek Park, where it's so heavily used, that's where more funds going to that would be far more desirable. Again, we're doing with so few funding that would be great. And we were also looking at how do we reduce some of the risks and impacts on the county. So Mariposa seemed like as the smallest space, with again that less service is the one that we would take offline.
Okay, Supervisor McGordy.
So I'm actually, I never thought about this, but 5 of the parks are in the 1st district. So we have actually kind of a high concentration in one district. A lot of them associated with water, and that of course is in a hot area. Having a place to dip in the water is something that's really desirable, which makes me want to think that the Mariposa swimming hole still has a real high value because of that. It's not a big area. We don't have any numbers, do we, on community usage, which is something that would be helpful. And the McKee Parkway, there's parts of that are kind of risky for people to go into. So those are some of my first thoughts on it. I served on Ukiah's Parks and Recreation Commission, and it really helps to have a tax base and a budget to afford these things. So I kind of agree with what Supervisor Hasjack said of trying to come up with a way of funding these. My other opinion is kind of looking at them, having visited most of these sites. I haven't seen every single one of them. Most of the time when you go there, the kind of the physical organization of them is, in some cases, rather odd and not necessarily inviting. And I think that's something that could also be thought about or looked at, is how things are physically laid out to make it so it's a place you want to go to and use. Maybe that's a longer term plan, but a lot of these parks seem kind of like an afterthought. Like somebody had a piece of land left over and they said, well, why don't we just give it to the county? And I'd be curious to know if the genesis of a lot of these places is if that's indeed how we came on. Sorry, I'm not giving you a lot of really helpful guidance here about what to do next, but I'm reacting to how I see it as somebody who cares about parks and has a background in landscaping and land use.
Janelle, do you have some information?
Just Janelle Rao, General Services. Just to add to that, yes, if you look at the origin of a lot of these parks, they were dedicated to the county under certain circumstances, many of them throughout time. At one point in time in the history of the county, we had a parks and beaches department. I believe in the 80s, it was transferred over to general services, somewhere around 84. There hasn't been an actual parks budget in my tenure with the county. And I don't know that at the transfer in the 80s that there was an actual funding mechanism that supported the parks, much like we're describing here. So I think today was really to get the information to you, to have the board be thinking about the future of the parks, the potential for these partnerships, as Supervisor Mulheron had mentioned, opportunities for potential concessioning, outsourcing maintenance, or decommissioning parks or selling them. And I think that these are all considerations. Regarding Mariposa, I mean, it's definitely something, I know I grew up in Redwood Valley, and it was a really important site for the kids in that area. With it being in the burn area from the 2017 fires and not a lot of funding gone into improvements, it is a fairly significant liability to the county right at the moment. But there could be an opportunity for the county to look at making some improvements and then potentially looking at a transfer, decommission, or some sort of partnership with the property owners in the area or another entity that may be interested. So on the county's website, you can find some of the origins of the parks. We do have information on there that tells us how they came to be, where they came from, and why they're there, which will give you some interesting reading, Supervisor McGordy. But yeah, I think at this point, we're looking for a general concept of as we're headed with the information, we come back to the board on some of the potential funding concepts, some direction for the board that this is the direction you'd like us to proceed.
A couple thoughts I have is we know that there's interest in the community in preserving our sort of heritage oaks and oak woodlands, and looking at the Low Gap, the two larger parks, the Low Gap and the Mill Creek Park. I'm just wondering if there's any opportunity to partner with community members and seeing if portions of those parks could be part of a network of parklands that would be, kind of represent a Mendocino County natural woodlands park. I recognize that it's not all, certainly there's active recreation on portions of those properties, but I'm not sure if there's enough just natural woodlands there that would work into kind of a bigger vision like that. And then on the Indian Creek, in one of the community discussions where I was present, there was a fair amount of discussion about the idea that there's an adjacent inn next door that they have sort of an interest in wanting to make sure that that's managed well because it's adjacent to their inn. And it just seemed like a natural fit. I mean, maybe there could be glamping there, but it's being run by the concessionaire, by the inn next door, not by the county. And instead of being a county cost, it's a county revenue stream that helps with the other parks. And then again, the community meeting I was a part of, the Faulkner Park there was some talk of that being like a wedding venue for Anderson Valley, but as a revenue stream. Anyway, so just those are some thoughts that I have about these parks. Supervisor Hatchak?
Thank you, Chair Jurdy. Yeah, that's what I remember too about Indian Creek, that there was a potential for, collaborating with that, whatever the business that was next door, and having them take over the concessionaire part. And then the Faulkner Park was a potential wedding venue. And, it seems like we could, collaborate with businesses that wanted to do those run those kind of businesses in those areas. I was also wondering about the CSA3 issue, if County Council thought that that would be one way of funding some of these parks. So if you looked at, Redwood Valley Lions Club or Mariposa and said, okay, the people in Redwood Valley really benefit from that area. So would they be willing to pay $10 a year, to keep it, to provide all the upkeep on it? So is that a possibility? And that's a question for County Council.
Thank you. If I may respond to the chair. Generally speaking, yes. So I think what you're referring to, Supervisor Hashak, is possibly forming a zone of benefit and then levying a special benefit assessment on the parcels nearby the park. You can do that. However, I would note that a park is sort of one of the classic examples where you wouldn't be able to recover the full cost through that model, because you have to separate the benefit to those homes that are near the park from the benefit to the public generally. And under the relevant case law, only the part that is a special benefit to those parcels can be assessed on the properties nearby. And then, of course, the amount that gets assessed is going to depend upon the independent engineer's report.
Okay, Supervisor Mulhern.
Thank you, Mr. Chair. One of the things that Lake Mendocino was challenged with a couple of years ago when they didn't have adequate staffing was really the opportunities of not receiving the revenue that they should receive. And that was in large part due to the iron boxes that were stolen often. Trying to accept cash in 2021 is probably an ancient theory, and we could possibly look at doing QR codes or websites, Venmo. There's all kinds of other opportunities. I would be happy to volunteer to work with staff on this project if there's any opportunity for an ad hoc to bring something back.
Okay, well, thank you. Janelle?
Just to further talk about, we have been approached by multiple parties throughout the entire county that have an interest in some sort of a partnership or concessioning. And I believe what will come of this when we bring this final phase 2 product to the board will identify, let's just say Indian Creek, for example. If Indian Creek were something that these parties were interested in, the county would need to decide how to enter into that. But if they would like to improve and invest in that prior to that concessioning arrangement, we most definitely are, well, we're currently working on online reservation systems as Supervisor Mulhern referenced. So a lot of this is contained in there as a potential to bring to the board. I want to mention that we have 1.0 FTE allocation for administration support for the parks. And then we have 5.0 FTE groundskeepers for the entire county system. That's 6 parks and over 100 facilities. That's where these points of reference are. And so what we will really need to drill down to is what's the future funding mechanism that the board wants to consider and develop it into a formula. And in everyone's defense here, there's not been a presentation of something that says here's a parks funding formula. So this is really the first opportunity for this board to consider that. So this information being presented here is somewhat new, but I would be suggesting that when we bring this forward, that be something that the board consider. Capitalized needs, ongoing maintenance, and then of course your resource that will support the parks.
Okay, thanks, Janelle. Supervisor McGordy?
So going back to my days on Parks and Rec, the state issued parks bonds on a pretty regular basis, and maybe Supervisor Mulhern remembers too from her days on the board. That was how we did most of our capital improvement funding. We also did some enterprise funding when the city had monies that they could invest in something they thought that there was a potential of an income stream back. So that's kind of a creative way that you can make improvements is those two systems. This also kind of assumes that either you can capture some sort of an income stream through parking or admission, or finally just pay through it out of the general fund, and probably a formula would be the way to go. It's clear though that, as I said, that these parks are not distributed uniformly around the county, but what you see is that where they tend to be concentrated is in places where there isn't any other park options. So when you get to the coast, there's so many beaches and other things that are available for recreation that the county parks aren't quite as important. But I assure you that both Low Gap and Mill Creek, Low Gap, and Lions Club are all heavily used. They really serve an important function for the local area.
Okay, Do we have any public comment on this agenda item?
There is no public comment for this item.
All right. Well, Supervisor Mulhern has generously volunteered to be on an ad hoc committee. Would anyone else like to be a part of a committee?
I should know better, but I'm going to say yes because I've done this before, so I have a little bit of background, and I think I could work pretty effectively with Supervisor Mulhern and trying to at least come up with some basic fundamental ideas about how we can manage this. It sort of fits into my background.
Thank you.
Okay, so I'd like to appoint Supervisors Mulhern and McGorty to an ad hoc to work with county staff to refine and bring back additional detailed proposals on management of the county parks. And I think we could just make that would staff prefer that as a motion or as a directive?
The directive is fine.
Okay.
No one
All right.
else. I think the direction is fine. We can do that. We will outreach to both supervisors and work through this. Our consultants I know are sitting and thinking. I see the wheels are spinning. So we'll assess, we'll regroup, and then we'll outreach to both supervisors and come up with a timeline. We appreciate your time.
Great, thanks.
Thank you.
Okay, well, that then takes us to item 6C, which is discussion of possible action, including direction of staff to take appropriate steps to transfer animal control services from the sheriff's office to animal care. Sponsor is Supervisor Hashak. And Supervisor Hashak, would you like to introduce the item?
Well, thank you, Chair Jurdy. Yeah, this is a long time coming. It seems like everyone wants to do it. The sheriff's office wants to do it. Animal care wants to do it. And it's a way of getting, the animal care and animal control services together. I think there's efficiencies that can be achieved with it. And you'll get this work being done by people who really care about the animals. And I think it's a win-win for the sheriff's office and for animal care. And also with the wildlife services contract, maybe in the future we'll be able to incorporate exclusionary services into this program. And so we're looking at the holistic approach. And this is a step that was presented, I think, in April, and we have budgetary numbers. It seems like the sheriff's office is in agreement. And animal care, Rich Molinari, has been in agreement too. And so it's just getting it moving, getting the people trained, and moving on with it. I think Rich Molinari, Director of Animal Care, has some ideas about how to really transform the whole animal control services program. But I think that will be in the future. So anyway, I don't know if Under Sheriff Brewster or Rich Molinari are on the line, but they might have something to say.
Through the chair, good afternoon, board. Everything that Supervisor Haschak has stated is true. I've been working with Rich Molinari for the better part of a year to get this working. We're ready to move forward. We're ready to assist the animal care with everything they need as far as equipment, vehicles, and personnel to get this thing moving forward. And we hope to do it as quickly as possible. As Supervisor Haschak stated, it's a need to the public to have the experts do what the experts should do. Animal care is well versed in this area above the sheriff's office, and I'm really looking forward to working with Rich.
Okay, thank you, Under Sheriff Brewster. Rich Molinari, would you have anything to add? Rich, you're muted if you're trying to address the board.
Rich, you can hit *6 to unmute on your phone.
Well, Rich seems to have some technical difficulty. Just a question, Supervisor Hashak, we have the animal care and control budget attached. Can you just clarify that is there a cost differential from what we're budgeting right now, or is it simply a matter of transferring the service over to animal care?
Yeah, I believe that it's just transferring the assets and revenue and expenditures from animal control over to animal care. And Under Sheriff Brewster, if you could correct me on that, I think I.
No, that's the case. The one thing that would have to be addressed once it goes to animal care is getting staff to field calls during the day. I've spoke with Rich about our dispatch assisting until that comes up to speed. And then we would assist at night to keep that going through our dispatch. So that would be a needed asset for his team, plus filling the vacancies that we have now to assist them.
Okay, Supervisor McGordy.
I'm just kind of curious about the stats of how many calls and how many, services the animal control typically does a year.
Rich Molinari here. I asked Under Sheriff Brewster a couple weeks ago on calls for service, what they get as far as coming into dispatch, and they're getting around 4,000 calls a year. I'm unsure on how many are actually worked out in the field, but as far as calls coming in from citizen requesting animal control services, it's about 4,000 a year.
That's a busy phone line.
Yes, it is.
And I think the hope is that in the future or I'm sure that this is happening already, a lot of those phone calls can be dealt with just by talking the person through the situation and making sure that everyone's safe and dealing with the situation in that manner instead of having to do a house visit.
Through the chair, that's correct. A lot of those calls would be completed by the animal control through the phone line, and if it's needed to be out there, if they're needed to go out to on scene, then they would do that throughout the county. The one good thing with animal care and beefing up this program would be you're going to have a lot better service through the public because they could be spread out throughout the counties, to where right now it might take us an hour plus to get to a certain location. It would be better once animal care got involved.
Rich Molinari here. And with animal care services here at the shelter, we're able to provide a little bit more education in regards to the requirements of responsible pet ownership. We can provide things as far as, services, if people are in need of vaccinations, assistance with some stuff as far as crates or kennels, dog food, kitty litter, whatever it might be. We'd rather have these animals stay at home, and we'd rather educate and work with our people out there and basically tell them all about responsible pet ownership and keeping the animals with the pets, with the people, instead of having them coming into the shelter. So we think we can do a pretty good job at that.
Okay, thanks, Rich. Do we have any public comment on this agenda item?
There is no public comment on this item.
Okay. Supervisor Hashak?
Yeah, thank you, Chair Jurdy. I'll move the recommended action.
I'll second.
Hey, we've got a motion and a second. Could we have a roll call?
Supervisor Mulhern,
Yes.
Supervisor Hashak,
Yes.
Supervisor McGorty,
Yes.
Supervisor Williams,
Yes.
Chair Jordy.
Yes.
And carries unanimously.
Okay, well, thank you, and hope for a successful handoff.
Thank you.
Okay, that brings us to our next agenda item, which is, let's see, it's item 6D, which is discussion possible action stating the board's intent to address Government Code Section 29121 through the budget process and mitigate unnecessary concern that impedes a department head, appointed or elected official's ability to perform their duties. And this is sponsor Supervisor Mulhern.
Thank you, Mr. Chair. This item was a continuation of a conversation that happened with the board during the budget hearings. After having discussions with the CEO's office and county council, I felt like this was the best course of remedy for the concern that was brought along to the department heads. So I'm happy to turn it over to Christian if he wanted to provide any legal advice or take questions. I think that really what the department heads are looking for is a clear direction from the board that we will continue to manage any potential overruns of their budgets through the budgeting process with quarterly updates. And of course, the opportunity that if they have something that is going to be over budget, they can, we will make sure that we can get that on the consent calendar or on a board agenda so that they could have that conversation with us before it goes, too far along.
Okay, thank you. County Council Christian Curtis.
Thank you, Mr. Chair. Just a few things I'd like to say on this one. I went back and I looked at the conversation during the June 8th budget hearing, and there was some discussion of this statute without a whole lot of the context, and I think there might have been some assumptions that might have been inaccurate. One thing that I do want to make clear is that while that the statute section does address state law, the issue really has to do with what happens in the event that an official ends up contracting for something that's beyond their authority. And this is an extension of sort of existing concepts in contract law and in agency law, where essentially if you have someone who works for any sort of entity, whether it's a corporation, a government entity, et cetera, and goes and enters into a contract for which they didn't have the authority to begin with, by default, the contract law does allow that the party they contract with could potentially have a right to recover against the individual who signed the contract, even if they don't have an ability to go and collect against the entity. And in the context of that particular statute, what that means is that if a department ends up signing a contract or otherwise authorizing the expenditure of funds for something that would be beyond the budget, the county has the ability to say the monies were never appropriated for that. We're not going to go ahead and honor that contract. We don't believe that it's binding on the county. In those circumstances, it can be possible for the vendor to then go against the individual. I'm not really aware of any examples of that having happened, at least not in recent history. But the general concept is that essentially if the vendor signed in good faith and they had some sort of expenditure there, there might be a recourse even if the person purporting to have authority didn't actually have the authority. That being said, I think the concern came up in the June 8th discussion more around sort of discussions about potentially sending a department head a bill at the end of the year. I want to be clear, sort of the existing processes, both in the statute and by what the county has been doing, really set out the initial year's budget essentially as an estimate based on projected costs and revenues for each department. And the intended process is for that to be adjusted throughout the course of the year as new information comes to light, whether that's a new need, whether that's a shortfall in revenue, or whatever that's going to be. And I think the discussion about the possibility of sending a department head a bill Frankly, I think that might have been thrown out sort of as a bit of an attempt to sort of show how impractical certain options might be in addressing this issue, and that really, what the board can and does do is make the adjustments both on a quarterly basis, but also more frequently if needed.
So another way of putting it, so the state law and the county's practice really envisions that a department would not have the authority to go and sign a contract and without getting approval and then obligating those funds. But at the same time, it also does not envision if a department has authorized personnel and the personnel cost for the year was greater than the amount budgeted. If the positions were authorized, the assumption is the budget would be adjusted to match up with the authorized personnel.
Yes, I would say generally yes.
Okay, Supervisor McGorty, then Supervisor Williams.
This is a question probably for the CEO's office. I'm curious how compliant departments are in general with their budgets. How good are they at developing a budget and sticking to it?
Chair Jurdy, if I may answer that, this is CEO Angelo, and then I will also ask Assistant CEO Darcy Antle as well. I can say in the 14 years that I've been here, it has been fairly consistent that our department heads do everything they can to stay on budget. There have been bad years and there have been good years. And during the very lean years where departments had to take budget cuts and where staff had to take cuts, I'd have to say that everybody jumped in to the best of their ability. I think the question of whether a department is over budget or underfunded is a good question. And we know that there are some departments that believe that they are underfunded, and there are some departments that we think could be over budget rather than underfunded. I think the challenge there is really to determine what those numbers are. The best way to do that, of course, is for us to monitor and manage every day as we do, and possibly to audit. However, I do think that for the most part, the county in general and the department heads do everything they can to stay within budget. And Chair Jurdy, if I may, I would like to just ask Assistant CEO Darcy Antle if she has anything to add.
Darcy Antle, Assistant CEO. I agree with CEO Angelo. I also like to add that since I've been in this role, every year we have tried to work forward to best practices through management and training. So we have training on a regular basis for budget process, budget entry into Munis. We work collaboratively with the auditor's office to continue to improve and streamline. As you know, there's lots of turnover in the departments. And sometimes when there's turnover, things get lost in the shuffle. And we are just trying to bring back some best practices and to continue the efforts to get all the budgets in a standard format for comparison for this board.
All right, thank you. Supervisor McGorty, do you have anything else?
No, my recollection is that most of the departments are, stay on track most of the time. That there's exceptional situations where they go off or over. One thing that concerns me a little bit is that we're somewhat understaffed in some of our departments, and it makes the department a little less effective when you don't have people who take care of things. And, something that long-term is part of the budget process that needs to be adjusted.
Okay, thanks. Supervisor Williams?
Would it be possible to get a monthly report of dollars spent versus budgeted? And maybe, is this a request to the auditor's office?
Darcy Antle, Assistant CEO. So there is, we presented at the end of last fiscal year, a year-to-date to actuals. So budget to actual. We have some concerns from some of the departments. that actuals don't really represent what's happening, as revenue tends to come in either quarterly or semi-annually. So we are continuing to work through that. We can get you actuals typically by mid-month of the following month, as it takes the auditor 10 to 14 days to close the month. So that was something that we were doing. We cannot do that now until fiscal year 2021 is closed, but our intent is to start those back up as soon as possible. And again, budget to actual could be misleading, particularly around the revenue side.
So could you walk us through, we have accounting software. There must be a feature that prints something like a balance sheet that shows income and expenses. And I understand that the revenue comes at odd times and it's grouped together, and sometimes expenses don't get entered immediately. But couldn't we generate that report with a few keystrokes, and it is what it is? If we all have the understanding of what we're looking at, we shouldn't be misinterpreting it, but it would give us a snapshot at a point in time of what we do know.
Darcy Antle, Assistant CEO, yes. As long as we're all under the understanding and that everybody reads the comment at the bottom, that again, this is budget to actual, it's a snapshot in time.
Yeah, so I would find that to be useful.
Supervisor Hashak.
Thank you, Chair Judy. Yeah, I think that the bottom line is that there needs to be, ongoing communication about the budget, any kind of issues that come up on a regular basis with the board and the department heads and elected officials. And if we have that free flow of information and on a regular basis, then we'll avoid these problems. And so I think that that's something that we all want. We want to be in the loop and make sure that the communication lines are open.
Okay, thank you. Supervisor Mulhorn, going back to you.
Thank you very much. What I'm looking for today is a roll call vote based on the recommended action. As it's written, I'm happy to read it aloud if you would like me to.
Okay, so we will go to that, and but I just realized we need to go to public comment. Do we have any public comment on this agenda item?
There is no public comment for this agenda item.
Okay, thanks. So go ahead, Supervisor Mulhorn.
Thank you. Would you like me to read the recommended action? Or does somebody want to make a motion?
You can make a motion of the recommended action. It's fine.
Sure. I'll move the recommended action.
Second.
Thank you.
Okay, we've got a motion and a second. Can we have roll call?
Chair Judy,
Yes.
Supervisor Williams,
Yes.
Supervisor Mulhern,
Yes.
Supervisor McGorty,
Yes.
and Supervisor Hashak.
Yes.
Motion carries unanimously.
Okay, it's close to 3:30. Would staff like to have us continue on or take a break now? Supervisor Williams?
Is it possible to get the monthly reports in as a directive or a request to the auditor, or whatever path needs to be routed?
We'll look into the CEO. So what would be the format for publishing it? Would it be attached once a month to the CEO's report? What are the thoughts on how to distribute that information?
Judy and Supervisor Williams, thank you for the question. I actually am very pleased with the CEO report. I think there's a tremendous amount of energy monthly in the CEO report, and if it pleases this board, I think the finance team would appreciate putting a monthly report into the CEO report for this board. So if that works for you, I think that will be a very effective way of getting the information to this board on a monthly basis.
Okay. I like that format as well, because all the county employees receive by email a copy of the CEO's report. So it's, it's good information for all the employees as well. So if that works for you, I guess we could record that as a directive.
And I think we had mentioned this at the last CEO report that we will be doing a presentation to the board on the directives. Hopefully in September. I think we have it scheduled for September. Based on the way the calendar is going, we'll try to keep it to September. Thank you.
All right, thanks. Okay, well, I didn't really hear feedback on whether or not we should take a break now or later. So let's go to the next item, which is item 5D. It's discussion and possible action, including adoption of resolution appointing Assistant Auditor Controller Shamis Cuppison as Mendocino County Auditor Controller to fill the unexpired term of office pursuant to Government Code. And the sponsor of this is the existing Auditor Controller, Lloyd Weir.
Good afternoon. Can you hear me?
Yes, we can.
Good afternoon, Chair Dirty, honorable board members, CEO Angelo, and County Counsel Christian. Lloyd Weir, your Auditor Controller, for 4 more days. I have, as you know, decided to retire. My last day will be September 4th. And this agenda item in front of you today is a request for you to approve the recommended action of appointing Shamis Cuppison as the Mendocino County Auditor Controller effective September 5th, 2021. Pursuant to California Government Code 25304, you are required to appoint an Auditor Controller to fill the remaining unexpired term of the elected office. At this point, it'll be approximately 16-month period between the next elected auditor. And of course, during that time, there's going to be some critical requirements out of this appointee. We are, of course, now in the middle of closing the 2021 books. That's scheduled to be completed in the next week or two. We are then scheduled to have our independent outside CPA firm do an audit. That'll be happening in about 3 or 4 weeks. We take a big active role in that. We also will be coming up early 2022 with the budget process. We will be also being heavily involved in the quarterly reviews. This appointee is an active person that will be engaged in that. And then before the 16 months is up, we will be actually going through another close at the end of 21-22 and another independent outside audit. So very important roles coming up for this appointee. And I want to let you know that Shamis Cuppison, who is my assistant, has been my assistant since January 2018. She has been a county employee for 13 years. Prior to working for the county, her work experience included fiscal roles in private sector with profit, for-profit, nonprofit, and local governments. For 13 years as a county employee, she has learned very much about the county's finances and budget work. She has developed an excellent working relationship with departments personnel, and county leadership. Shamise has been an active participant in the County Leadership Initiative since its inception and a founding member of the Mendocino County Executive Leadership Team. She's recently obtained her California Association of County Institute Excellent in County Government executive credential and has attended several Government Finance Officers Association accounting intensive trainings and national conferences. Shamise holds a bachelor's degree in business management with an emphasis in accounting and has the required experience to qualify the auditor-controller position. We also are very involved with our departments in exercising general supervision, including the ability to review countywide internal controls and help with accounting forms and methods of keeping all accounts in all offices, all departments of the county, and all institutions who have their money under the control of the board of supervisors, including the districts and agencies who keep their money in the county treasury. I have truly enjoyed my time as the auditor controller, and I feel I've grown personally and professionally. I'm very proud of the work we've accomplished and the strong financial position that the county is in. I would like to request that you approve the recommended action, and I wholeheartedly recommend the appointment of Shamise Cubinson to fill the unexpired term of the auditor controller beginning September 5th, 2021. Thank you, and I'll take questions.
Okay, thank you, Lloyd. Supervisor Mulhern.
Lloyd, can you just describe why you aren't finishing out your term? Please.
So this has been a long decision for me. It's 39 and a half years working for the county. This is coming to the end of my second term, but I am in a position now where I can be with my family more. My grandchildren are wanting me to come and spoil them. My wife and I want to get in our RV and do some traveling. And the numbers just work out right for me now. Personally, this is my decision. So that's why I'm going now.
Okay, before we go much further, we have a number of correspondences on this agenda item, and I did want to go to County Council. County Council did write to the board a memo outlining the procedure under state law, and I'd like to poll the board, but if the board agrees, I'd like to have that memo uploaded to the website and made public. I've checked with County Council ahead of time, so they're not being caught off guard on this. Would the board agree with having that memo made public?
Yes.
Okay, seeing confirmation. Okay, all right. So County Council, Christian Curtis, can you make those that memo which describes the options made available to the public?
Yes, I'll forward it to the clerk of the board right now and ask that they upload it to the item.
Okay, thanks. Supervisor Hashak.
Thank you, Chair Jordy. Well, first of all, I'd like to thank Lloyd Weir for his work. 39 and a half years is commendable in any situation, but certainly in a pressure cooker like the auditor or controller, that's a very, it's stellar work. And thank you for, all the interactions I've had with you have been very positive and, solution oriented. So I appreciate that. One question about Shamise Cubinson is there a resume for her that I'm not seeing? I saw her letter with her qualifications of 13 years for working for the county, which is commendable too. And then you just mentioned that she had a BA in business management. I was just wondering if there was an overall resume that we could look at.
Yeah,
Through the chair, if I may, Shamice Covison, Assistant Auditor Controller. If that is necessary to provide for somebody for review, I would be happy to provide that.
Okay, thank you. I'd appreciate that.
Supervisor Williams?
Yeah, so I only know the information that's attached to this item, which is fairly thin. Is there an HR review on file that I could look over?
So I don't know if that's a question to the HR department or the CEO's office.
I don't, or Lloyd for sponsoring the item, but I just feel like I don't have a lot of information. I'm acting in the blind here in place of the public because we can't hold an election. I would just like to have as much information as possible to make the best decision. And I imagine if maybe the latest review from HR would be appropriate.
Mr. Chair, if I may.
Sure, go ahead.
I just want the board to be aware, because this is an appointment to an elected office, any of the materials that the board receives in this context would not be confidential in the same way that personnel records typically would be for another position. So if the auditor or if the candidate wanted to submit the materials, they certainly could do that, but it would need to be uploaded as part of the board item. I don't know that the board members could just look in the confidential personnel file without otherwise making it public.
So to county council, so the only way for a personnel file to be made public would be if the county employee voluntarily made it public, is what you're saying?
Correct.
Okay. So I guess I'll redirect that to Shamice. Would you be willing to make that public?
Through the chair, I personally don't understand why that would be appropriate to make my entire personnel file to the county visible to the public. I mean, I would not have a problem with somebody individually reviewing the file if they want to report back. There's nothing to report that it would be other than exemplary reviews. But I think that's kind of taking a little bit far to ask to look at my 13 years worth of personnel records with the county, with all due respect.
Okay, Supervisor McGordy?
So yeah, actually, I would not expect Auditor Guard to be moving Ms. Covizon's application forward if they didn't have confidence in her. But I am kind of concerned just because I've never seen a situation like this before, where I have really wonderful and not so wonderful recommendations for somebody. It's a bit of a paradox, and people who I respect have written in on your behalf to support your candidacy, and yet there's other people who haven't, and it kind of puts our board in a difficult position to try to understand who do we believe and why, and I think that's why we're having this discussion. I'm a little bit of a loss at what is a good point to move forward, and then I think long term too, this is a time when our board is kind of reviewing the overall structure of county government, and how we manage our finances is something that is worth having a discussion long term. The Marin County model has been mentioned by the district attorney as a way possibly that Mendocino County should be organized, where there's one department that really handles all financial affairs and they have a chief financial officer. Right now it's kind of partitioned off into different places, and there's different levels of trust and comfort by department heads with different units, which concerns me. I don't understand that. So I think our board is struggling a little bit with this whole situation and trying to decide what to do. And certainly I am. Maybe the other board members have their minds made up, and it's just me struggling with it. But I find this very paradoxical.
Chair Jordy, may I speak for a moment, please?
Yeah, I'd like to go to you, Shamice, and then any member of the public that wishes to address the board. Go ahead.
Through the chair. So Shamice Covison, Assistant Auditor Controller. The role in the Auditor Controller's office is not always a popular role. Part of the main focus of the Auditor Controller's office is ensuring that county department heads adhere to county policy, board policy, state, financial requirements, other program requirements, IRS regulations. And that isn't always a popular position to be in. And sometimes we're in a position where somebody wants to do something that doesn't really fit within those guidelines, those procedures, those policies. And, unfortunately, we're in the position of having to ask for more information or say, that doesn't really fit. Can you explain to me how you see that what you're requesting actually fits within those programs or within those policies? And, unfortunately, I see, there are comments that have been posted about disagreements between the auditor's office and the district attorney's office. It's been an ongoing issue, I think, for the last 3 auditors, not just while I've worked in the auditor's office. And the district attorney, I think, is a good prosecutor, a good district attorney. But sometimes we come into conflict about what is really allowable under county policy, under IRS regulations, and what is appropriate. And if the auditor controller is charged with ensuring that there are adequate internal controls and documentation for those transactions throughout all county offices, then there are going to be times of conflict. And there have been, changes to policy which are in the board's purview to accommodate some of the requests of the district attorney. But at the time that we had conflicts, there were specific requirements written into those policies. And some of the conflicts we have, for instance, regarding travel, are required to be documented by a travel request, whether it's signed by the district attorney or signed by the CEO. It needs to be provided. Otherwise, those reimbursements need to be taxable. Fringe benefits. The IRS requires that we receive that information that documents who went where when. How long were they there? Why were they there? When did they leave to go there? And was it a justifiable business expense? That is not us trying to be difficult. That is us complying with IRS regulations, or we would be required to pay those individuals through payroll on a taxable basis. And, the board has amended travel policy to not require the CEO's office to sign off on it. But those other requirements, while unpopular and maybe additional paperwork that the district attorney does not want to provide, are still requirements. There are other areas, that we have disagreements, and that has to do with asset forfeiture funds. If the district attorney believes those are not public funds, that they are district attorney's funds, we are still, if you read the attorney general's opinion, those go through the county first before they go to the district attorney. And there are certain provisions that still require and are still intended to have those go through ordinary procedures for fiscal management of the county. There's still minimum requirements for evidencing those expenditures. And so we do have conflicts sometimes with the district attorney's office. So, I'm sorry if sometimes the district attorney's office does not like that we get into debate, or that I ask for additional information, or that I require further clarification. But I'm not going to be intimidated to only pay things that the district attorney in the way he wants them paid without seeking the appropriate documentation. That is the requirement of this position. That is the role of this office. So I would hope that you want somebody in this office that is dedicated, outspoken, and going to do their job. And I am seeking appointment to fulfill the term because I feel passionately that this is an important role in the county. This office, I don't think the public understands, but yes, we process accounts payable, we process payroll, we manage portions of the budget, we help the CEO's office monitor it, but we also pay out $160 million to special districts, cities, the county. We calculate the tax rate, we do the bond calculations, we distribute that money. There are very important roles in this office. And I personally feel like it needs to be somebody with integrity and who intends to do the job to their best of their ability. And, that's how I feel. So if you want to know why I want the job, and that's why I'm passionate about it. But, you could ask Howard DeShiel. I worked for him for 10 years. I know I did a great job for him. I had very successful 6-year audits with no findings. That is the level that I would hope to continue in this office. Other departments have said, gosh, I hate it when you tell me I can't do something, But yet on the other hand, when they get an exemplary audit from the state that says this is the best I've ever seen, they present me with a certificate saying, thank you for holding us to the standards, that now we can have this exemplary audit with no findings, because unfortunately you did hold me to the standards and require the approvals or told me no when it was inappropriate. Thank you.
Okay, thank you, Ms. Covison. Supervisor Williams?
Yeah, for a while I've been asking about whether we should have a CFO. Essentially, under California Government Code 26980, we have the possibility of creating an office of Director of Finance. And the response has usually been the time to talk about that is when the seat is not filled. You don't talk about consolidating electeds or restructuring. Well, this seems like it's the opportunity. Glenn, I'm curious, how does this potential direction fit in with your vision of the strategic planning?
Well, you know, the purpose of strategic planning is to come up with a well thought out and organized county government that functions well and has the kind of structure that makes sense and most importantly serves the taxpayers of Mendocino County as efficiently as possible. And I look kind of at the way that we're set up with our financial departments right now, and they don't always seem integrated. And I'm not really understanding why we have the structure that we do.
Okay, I'd like to go to public comment. And do we have anyone who would like to comment on this agenda item?
Chair Jordan, we do have the district attorney on the line.
Okay, go ahead.
Can you hear me?
Yes.
Good afternoon, board. I have provided you documentation and background on why we're opposed to this appointment. My staff is 13 years is a long time. My staff normally doubles that as far as experience, and they're very good at what they do. Unfortunately, it's not just that they want a piece of paper here or not. If you'll see the memorandum from Catherine Cavness, we're being advised to take ourselves into a adverse audit exception on bad advice from Ms. Covison. And it's not just the district attorney's office. We follow rules of the state Cal OES and other agencies that we work with, and we work closely with them and work well. My belief is that this is time to consolidate the departments as allowed by the 27 legislation that I suggested to you that's out there. We were given special permission, not every county was given that, to allow that consolidation for purposes of efficiency, cost savings, and effectiveness. Eventually, and by the way, I'm not suggesting that you go to the step that Supervisor Williams suggested immediately, because I think that Sherry Schattmeyer does well. But should we come to that point where she wants to retire, I think the court should well consider going to a director of finance model where we have a more qualified, higher experienced, and I guess higher powered individual to come in as our CFO. I note, I'll tell you this, folks, if I was asking for your appointment and you want to see my personnel file, you could see it in a second. So I'm wondering why that's a problem. Also, I look at the documentation that was sent to you, and this was supposed to be a rubber stamp, or so it seems, because there's literally no documentation before you. We have always, I've come to the board, and if you ask the CEO, I've come to the board multiple times, and never once has the board upheld the Ms. Covison's decisions or Mr. Weir's decisions when it comes to the problems we've ran into regarding finances and obstructionism. If you do appoint Ms. Covison, I expect I'll see you more often, which may be a good thing. But I was just hearing recently that your agenda is pretty full going forward. But things like attorneys going to conferences that are required by their MOU with the county, me, and the attorneys union, that we can't get those paid. That's ridiculous. And when I actually went to the board actually at that time, I understand that, for example, Supervisor McGordy and Supervisor Mulherin weren't there at that time, probably Supervisor Williams perhaps also. But the board says, why do we have to deal with this stuff and the likes? Ms. Covison just told you that these travel authorizations need to be approved by the CEO's office or by me. Well, you know what? The CEO's office since 2008 has had an exemption on those because they understand the documentation we provide is always legitimate, good, and it covers the IRS responsibilities. So what you have is basically this is a case of demanding a piece of paper that doesn't need to be provided because the CEO's office says we don't want to have to micromanage and approve your travel. We do a lot of travel for conferences, for investigations and the likes. And it is not, and the CEO understands this, it is not to the public's advantage to have to get authorizations for us to go out and investigate things where we tell the public where we are and why we're going there. That just doesn't work for us. As for the asset forfeiture, this has always been a bone of contention with the auditor's office. They're wrong on it. They've always been wrong. And when I've had to go to the board to seek approval to force them to do something, they have never won once. So at some point, they have to get it right before you make this appointment. So I apologize. I hate having to do this, but this is too important of a position. I also provided you the outside law firm opinion as to the responsibilities of the auditor-controller, which was almost rejected completely by the auditor. And I think what you heard Ms. Covison saying is that what she wants to do is contrary to what the law says they should be doing. I take great pride and I have great transparency as what I've done for the district attorney's office in the last 11 years going on 12. I wish the auditor controller good luck with his retirement. But when I told the public I was going to run and stay on for 4 years, I meant it, and I did, and I will. So I think what we're seeing here is an early retirement to try to get this appointment, and it's not the right person, it's not the right time, and it's an opportunity for the county to work better, raise the bar, and can either consolidate or go to the CFO model. Thank you very much.
Okay, do we have any other public comments?
There are no further comments on this item.
Okay.
Chair Drury, if I may respond briefly, I'll try
Go
to
ahead.
be brief.
Yeah, go ahead.
So Assistant Auditor Controller Shamice Covison. So the District Attorney's Office has most recently been is unhappy with the direction of how they cost apply their salaries to their Cal OES grant. They are the only department that has currently been allowed to continue to reallocate their salaries in the actual 1000 series. We have been reallocating salaries through the 2000 and 5000 series for many years in every other department. And that includes the Department of Transportation, the Department of Health and Human Services, that also have Cal OES and FEMA grants. No other department or funding agency has had a problem with that practice. And whatever information they conveyed to Cal OES and got an opinion from them is not substantiated by past practice. So it's been done for the last 20 years in the Department of Transportation and many years in Health and Human Services. So that practice has been perfectly acceptable and is not going to cause an audit exception for them. I asked the District Attorney's Office, I advised they could do it again this year, but to please contact their grantor and make sure they update their budget so that when they file their next grant application and their next billing, that it would meet that application and budget as presented to Cal OES. It was not inappropriate. It's how we handle it in every other department. Thank you.
Okay, I see a hand raised in the clerk of the board's office.
Chair Jordy, thank you. This is CO Angelo. I know that the district attorney has his hand up, so I hope that you'll go to him next. I would like to make a couple comments. One being that it's unfortunate that I feel like we're off topic a little bit and that we're in this debate. And I don't think that anyone on this call in the Zoom really could respond to that debate. I think that there is a debate and everybody has a good position. What I would like to say is that since January, obviously I have announced that I will be leaving next year, and that Supervisor McGorty and Supervisor Mulheron, when they came on, and certainly Supervisor Williams and Supervisor Hashak and Chair Jordy, you were one of the first supervisors over the last decade to really push for a strategic plan. And the operative word there is plan. This board wants some planning. This board, you five right now, want to leave this county in a better position than you found it. And we all would like to do that. But you five have taken a step, a big step, in hiring someone to do a strategic plan and focusing on the strategic plan. One of the concerns that I've had with the strategic plan is around governance. Because whenever anybody talks about governance in this county, they talk about the CEO. And they talk about a CEO versus a CAO. Like that is the most important piece of governance in this county. And quite honestly, since I've sat in this position and been here for the last 14 years, I don't really think it's the most important piece. The most important piece is what this board, what this legislative body wants to do going forward. This county has 5 elected officials and 5 elected supervisors. That's 10 elected officials that, for the most part, can work independently. So when you talk about pulling together a team, it's a difficult task to try to pull together a team within a county system. So what I would like to say to this board, and certainly to our auditor, Lloyd Weir, and our assistant auditor, Shamise Covison, is that there have been a lot of thoughts by prior boards and this board, whether we have an auditor, whether we have a treasurer, whether we have a combined position, whether we have a chief financial officer, and so the CEO is just one minor component. It's one position in a whole big county of over 1,200 people. So I would respectfully request that you look at your strategic planning process, what you'd like to do. And when you talk about governance, and Supervisor McGorty, you're one to talk about governance, that you really look at the auditor position as well. And so I would just ask that you don't jump in, and I understand Ms. Covison's role and the important component that she plays in county government. But I would really ask that this board step back and not do what you always do. In this county, when you ask, well, why are you doing it this way? The key answer is because we've always done it this way. And we've always done it this way. And so can we stop? And this is what this board wants, not what I want, what you want. And I think it's good to really look at the strategic planning process and how you want to proceed. And if you could not make any other appointments at this time and really wait and go through the strategic planning process, it may be the best thing that you do and your legacy that you leave for this county, that you're not doing things the way they've always been done, but that you're actually doing something that you think is reasonable and the right thing to do. Thank you.
Okay, Supervisor McGorty and then Supervisor Hashak. Well, first, District Attorney, do you still have your hand raised?
I don't have my hand raised. I listened to the CEO and she speaks truth.
Okay, Supervisor McGorty, then Supervisor Hashak.
So first of all, thank you, CEO Angelo. That was well said. And sometimes we are creatures of habit, and these things are complicated and complex. I think you framed it nicely when you said there's 10 elected officials. And sometimes it's hard to get all of us pulling the same direction. But I do have a question for Councilor Curtis. So if we don't appoint anyone today, what happens in terms of how do we function in the auditor office?
If I may answer to the chair. So if an appointment isn't made today, per state statute, what happens is once the auditor retires, the next in the chain of command is charged with discharging the duties. So this is the same analysis essentially that I gave you when the sheriff retired, and that you had chosen to make public at that time as well. So you can't call a special election. There's no mechanism for that. You can't make any sort of interim appointments. There's no mechanism for that. Your choices are either to appoint someone to fill out the rest of the term, or don't make an appointment, in which case the assistant discharges the duties, but isn't essentially elevated into the position for the remainder of the term. And that leaves a possibility, you can't make an appointment too close to the election, but that raises the possibility of some sort of other appointment or something along those lines somewhere down the road.
Okay, Supervisor Hashak, do you still have your hand raised, or?
No, that answered the question.
Okay, that was your question. Okay, Supervisor Mulhern.
Thank you. Would it be possible for Supervisor McGorty and Supervisor Hashak to bring back the potential of a consolidated Department of Finance when we have the CEO versus CAO conversation as part of the strategic planning? I realize you haven't been working on that yet, but is that something you could bring forward?
So I'd like to answer it this a couple ways. First of all, I don't think that we have the innate knowledge to come back with a good recommendation. I think what we really need is somebody who understands this position with this point of view better. There are people who do. I think of Pat Blacklock from RCRC, who is their executive director. I've talked with him already about this, about consulting the board on the structure of county government, and he's quite good. And that's the kind of level of discussion I think we need to have with all 5 board members involved.
Supervisor Hashak?
Yeah, I think that's a good idea that Supervisor McGorty had. You know, we can address this somewhat through the strategic planning if we gave additional direction to our consultants. But whether they're really experts on that aspect of county finances, that's a question we don't know right now.
I've already asked them about the whole issue of governance and county structure, and they said they know things in a general way, but not in a specific way.
Right. And so anyway, we could talk to them, but I think that we could get outside advice too.
And also, I want to apologize to Ms. Covenson for putting her in such a difficult position. I think that there's a lot going on that has not necessarily anything to do with her qualifications. This is a point in time where the board has a chance to make other structural changes. And I think that's the direction that we're considering. So certainly we'll be working with you in the immediate future, and that doesn't necessarily mean we have no confidence in you. It's just that we're considering other options at the same time. At least that's my opinion. Maybe other board members have different opinions, but that's my personal expression.
Okay, Ms. Covison.
Through the chair, Assistant Auditor Controller Shamice Covison, I'd like to know, if you choose to take no action, what your direction is to staff for how this office is supposed to function. The Auditor Controller is a full-time, more than full-time role in this office, and we are already short-staffed. So I'd like to know how you expect that we will continue to maintain the level of service we provide.
Well, I think that would be a discussion between the office of the Auditor Controller and the CEO's office to bring back any recommendations for interim staffing recommendations. My own opinion is I think it puts the board in a weird position, and the public really questions it when we make appointments to fill elected positions. We certainly received some criticism by filling the position of sheriff. This is a little different than that, even because there's always going to be a sheriff. There is not necessarily a need under state law to have an independently elected treasurer and independently elected auditor. They could be one position under state law. And personally, I think that would be a more streamlined way of consolidating the county's financial offices. One thing I would really like to see from the people who work for the county in the fiscal arena is more innovation, and not simply looking at sort of rote routine functions, as important as they are, but also looking for new ways to improve services. And I haven't really seen enough of that during the 8 years I've been with the county. And I'd like to see more of that from the leadership in the county's fiscal team, especially in the elected offices. And I've spoken with the auditor about one of my concerns, where I feel like the county is leaving revenue uncollected, and yet we have a number of squabbles within the county family over the dollars we do collect, and we're not actively pursuing dollars that are not being collected by the county. So I think we could more productively spend our time if we were to take a more progressive review of our fiscal functions. I'm going back to the clerk of the board's office. I see a hand raised there.
Yeah, Chair Jody, thank you. This is CEO Angelo. I think that not to keep jumping in on this, I'm really only trying to help here. I think that a couple of questions that came up, one certainly from Assistant Auditor Cubison, as well as your comments, Chair Jody. We can look at the executive office absolutely would like to work with the auditor's office on a short-term fix, and then certainly with this board on a longer-term solution. And for a short-term fix, my finance team and the auditor's team can work together starting tomorrow as far as some of the needs that the auditor's office has and how we can assist. We do have a finance team that could assist possibly with some of the work of the auditor's office on an interim basis, and certainly assist the auditor's office with any expediting any extra help positions. So, I would like to assure Lloyd and Shanice that we'll do everything we can to assist. This is not easy for anyone, but we will help them as much as we can, including taking on additional tasks of the finance team if needed. As far as long-term, Supervisor McGorty mentioned Pat Blacklock again. And actually Supervisor Williams and I and Supervisor Mulheron met with him not long ago around broadband. And I certainly have talked with Patrick regarding strategic planning, and Supervisor McGorty is right. He is ready and willing to assist us, and he does have some expertise. If this board would like, I also did speak with our consultants over the last couple days as well. If this board would like, the consultants want to come and do an update to this board. And, I feel like we need to have board meetings every day, Monday through Friday, the way our agendas are going right now. But I think this is important enough that if the board would like to have a session, and this may have to be a special meeting, but we could have a session. You could pull the consultants in, and we could look at, I know you really want to look at CEO versus CAO model, and absolutely that's what you want to do. Again, let me say that is one position out of 1,200. And we could also look at auditor and chief fiscal officer, and we could try to have a beginning of a session on all those positions if you would like. We could work on an extra day and look at doing a workshop. But again, the point is short term, the executive office and the finance team will work with the auditor's office to do everything we can to support them at this time of a staff shortage. And long term, if this board chooses whichever direction you want to go in, we will arrange an additional day. We will arrange a workshop. We will get any consultants you want, and we can have the discussion. You can have the discussion publicly around a chief financial officer versus an auditor versus a CEO, however you choose to do that. So I throw that out there, short-term, long-term, whatever this board would like. Thank you.
Okay, thank you. And I'm certainly happy to have an additional focused meeting, special meeting like that. Supervisor Hashak.
Thank you, Chair Jurdy. So reading this memo from County Council is that if we don't appoint a successor to the auditor's position, then the assistant auditor will discharge the duties of the auditor until a successor takes office. So, I guess Ms. Covison would become the acting auditor in a way, would perform those duties of the auditor. Is that correct?
If I may answer to the chair, yes, that's correct. And sometimes that is referred to as acting, as distinct from, say, interim, which the board doesn't have the ability to do in this case. Essentially, if there is no appointment, the duties get discharged by the assistant.
Okay, and if the assistant auditor had to take over the duties of the auditor, I would think that the compensation would be adjusted too.
So there is a provision, I believe, in some of the relevant MOUs that do provide for increased compensation when filling the office above. I don't remember exactly the terms on that. HR might be able to answer.
Okay, thank you.
If I may, Chair Jurdy.
Okay, HR Director William Schertz.
Yes. To answer the question, yes, the MOUs do provide, actually we have a policy, a county policy that provides an individual that's put into an acting or an out of class position to obtain a, for out of class, it's a 5% increase of their salary, and to an acting would be considered no more than 10%, but what that individual would have been put at from a salary perspective if promoted into that position. And so there are some additional opportunities to be compensated for doing those higher level duties.
Okay, thank you.
Okay, what I'm hearing from the board is a desire to leave the assistant auditor in the position of assistant auditor and not take further action on that, other than to request that the CEO's office work with the auditor's office to help develop an interim staffing plan for that office and for the CEO's office to help manage the workload while there is no appointed or elected auditor. Looking to the clerk of the board or county council, do we need a motion to that effect, or do we need, what does staff need at this point?
If I may, if you're not taking a final action of appointment, I don't know that a motion is strictly speaking necessary. However, I think it would be helpful just to have clear direction to staff if that is not or if no appointment is to be made as to what direction is to be given. So I think you could do that by consensus as long as the clerk of the board adequately understands the direction.
Okay, so is it consensus of the board to take no action to fill the position of auditor controller, but to direct the CEO's office to work with the auditor's office to ensure adequate staffing during the period in which there is no appointed or elected auditor?
Yes.
Yes.
Yes, but I also would like to include the future conversation around the possibility of a Department of Finance. So I don't know if you want to do that next.
Okay, and we'll add to that the request that the strategic plan ad hoc committee work with staff to bring back an agenda item, could be a special meeting, to discuss the options of either auditor or a chief financial officer.
Yes.
Chair Jurdy, this is Theo Angelo. We'll take that as one directive with a short-term and a long-term direction.
Okay. Okay, thanks. Wish everyone well in their next adventure in life. Lloyd, including, hope you get time with your
Thank you very
grandkids.
much. Thank you to the board and to the CEO and her staff, and of course, all my coworkers, and especially my auditor-controller staff. They're outstanding. Thank you all.
Okay, thank you.
Lloyd.
Okay, we are going to take a 10-minute break and we'll come back at 4:25.
We are so lucky to live in Mendocino County. The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike or sound alike,
but we are all one community.
During this pandemic,
we need to be kind to one another
and keep each other safe. By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet में आया. Podemos hacerlo por todos nosotros.
ఇది మనందరికీ సాధ్యం.
A gente pode fazer isso. Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste. આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं. या ये all day.
I got vaccinated because my children can't get vaccinated. Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
We are in the race of our lives.
For all of our lives. Against COVID-19.
The virus keeps changing into new variants.
Which is what viruses tend to do when they spread.
Some variants are more contagious.
While others cause more disease and death.
If we do not stop the spread of COVID-19 soon,
some variants may develop that we do not have antiviral therapies for.
Some could make our vaccines less effective or not effective at all.
this would set us back to where we were last year. When we were worried that our hospitals would be overwhelmed.
When schools closed and children had to shelter in place.
And when we could not see friends and family for fear of spreading COVID-19.
So it's so important that we take all necessary precautions to protect everyone.
Especially the most vulnerable among us.
We need to vaccinate as many people as quickly as possible.
To save as many lives as we can.
Together, we can win this race.
For our patients.
For our elders.
For ourselves.
For you. For us.
For our community.
Por nuestra comunidad.
Yo me vacuné porque amo a mi familia y amo a mi comunidad.
Yo me vacuné para no exponer a personas vulnerables y no poner en riesgo las personas que amo.
Yo me vacuné. Mi vida es importante, mi salud es importante. La salud de mi hijo, de mi familia, de la comunidad y la humanidad es importante. Vacúnense.
When I got vaccinated for a different reason than I'm telling you to get vaccinated for. I got vaccinated in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too. Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
Los latinos componemos el 25% de los habitantes del condado. Aún así, la mitad de los casos del COVID somos nosotros. Nuestra comunidad depende mucho de la población hispana. Desafortunadamente, no recibimos la protección necesaria, así que es importante que nos cuidemos uno al otro. De este modo, no perderemos a nuestros seres queridos y podremos disfrutar de nuestras reuniones familiares.
We are our ancestors' children, and we carry their intergenerational traumas attached to trusting the government and vaccinations. I can say I lived through a pandemic by choosing to get vaccinated. I chose to get vaccinated because I had to be a good leader and example for my people. I also got vaccinated to protect my daughter, who has a compromised immune system. I urge you to get vaccinated to become a protector of our elders and Native community.
Cuando contraté el COVID me espanté, pero cuando admitieron a mi papá al hospital con la infección de COVID me espanté aún más. Por eso me vacuné, para protegerme a mí y a mi familia.
We are so lucky to live in Mendocino County.
The beauty of this place is reflected in the hearts of the people who live here.
We may not all look alike
or sound alike,
but we are all one community.
During this pandemic,
We need to be kind to one another.
And keep each other safe.
By being careful not to spread the virus.
And by getting vaccinated as soon as we can.
We need to do this for each other.
And we can do this together.
We can do this!
हम सब कर सकते हैं.
ये bet me आए.
我们能够做到.
Podemos hacerlo por todos nosotros.
Idi manandarki sadyam.
A gente pode fazer isso. Yun robrum knia.
Wamanye mape.
Aba, kayang-kaya natin to.
Wir können das schaffen.
Namaste, આપણે કરી શકીએ છીએ.
Ehikino kako.
हामी यो गर्न सक्छौं.
Yeah, yeah, all day.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my
Just for
mom.
confirmation,
Her
I
birthday
believe
coming up.
we're next on item 5F. Is that where you have us?
Yes, that's what we have.
Okay, so 5F is sponsored by Human Resources, and it's discussion possible action, including direction that Human Resources submit a resolution for adoption by the board, amending the position allocation table. So we have HR Director William Schertz.
Yes, good afternoon. William Schertz, HR Director. Give you the background on this. In November of 2019, the Mendocino County Sheriff's Office contacted Human Resources and requested to reclassify a vacant public safety dispatcher to a Network Systems Analyst 2 through an add and delete function in Budget Unit 2310. This request was the result of the retirement of a public safety dispatcher who had been assigned duties in support of the Sheriff's Office IS staff. And the Sheriff's belief that the department needs would be better met with a network systems analyst. In accordance with Policy 22, the Information Technology Policy, Human Resources sought the approval of Information Services leadership to add an IS position to a department other than the Centralized Information Services Department. Human Resources also sought the assistance of IS staff in determining the appropriate classification for the work the Sheriff's Office was intending to assign. After a series of meetings and emails in which IS recommended an information systems specialist be allocated to the centralized IS department to provide dedicated support to the sheriff's office. No formal recommendation or direction was given to human resources. So this request is before the board today for discussion and possible action that may include direction to amend the position allocation table. And the following options are based on the requests and recommendations discussed. Option 1 is allocation of 1 full-time equivalent Network Systems Analyst 2 as requested by the Sheriff's Office to the Sheriff's Office Budget Unit 2310. Or option 2 is 1 full-time equivalent Information Systems Specialist as recommended by IS staff to Information Services Budget Unit 1960. Please note, if direction is to allocate 1 FTE Network Systems Analyst 2 as requested by the Sheriff's Office, the Public Safety Dispatcher position is no longer vacant. As of December 27, 2020, the Sheriff's Office transferred an employee into this position. So if so, Human Resources seeks direction from the board as to whether a vacant position from Sheriff's Office will be required in exchange for any added allocation resulting from this discussion. Human Resources will work with the Sheriff's Office if this is the determination in determining an appropriate vacant position for deletion if required. And that's all I have for you on the overview of this item.
Okay, thanks, William. Do we have anyone from the Sheriff's Office here for this agenda item?
There's something strange going on with the computer here. Can I be heard?
Yes, Sheriff Kendall, we hear your audio.
Okay, I'm not sure how this came up. My undersheriff was advised of it last week. We put in for this position like a year and a half, maybe 2 years ago now, and it was pulled without our knowledge. I don't know why it suddenly popped up now. Undersheriff Brewster is also available on the meeting. When we first put in for this, we had as Mr. Schertz recognized, we had put in for it and we were going to do an add delete. We no longer have that position to delete. So I'm not exactly sure which direction we should go on this.
If I may, Mr. Chair.
Go ahead.
And I didn't mean there to be any mystery. I did ask Human Resources to go ahead and put this on. Just to clarify, through the chair, Sheriff Kendall had requested counsel in some of the prior litigation in order to address essentially whether or not he had a claim against the Board of Supervisors for failing to create this position. I had suggested, since it hadn't actually gone to the board, that Human Resources go ahead and get that in front of the board so there'd be some sort of direction or clarification as to what the board wanted to do before there was any sort of litigation resulting for it. I didn't mean that to be some sort of mystery, although obviously, given that those proceedings had been happening rather quickly, this was a bit of short notice. I wasn't aware that the position had been filled at the time I made that request. I think at this point it would be useful just to get clarification from the Sheriff's Office as to if they'd like to continue to proceed with this, and if they do, sort of what the request is, and then the board could decide whether they want to go in that direction or whether they don't want to go in that direction. I just frankly had thought it was a little bit silly to be potentially litigating a question of denial of a position that hadn't actually gone to the board yet.
Okay, Under Sheriff Brewster, would you like to add something?
Thank you, Chair, members of the board. As Sheriff Kendall stated, yeah, I was actually puzzled when I was contacted by HR regarding this position, saying it was almost exactly 2 years ago that we put in for it. At that time, we were doing an add delete. It's a very different time now to make that continue on as we were looking to do back then. We had a dispatcher who was also doing IT work. When she retired, we wanted to do an analyst position to assist our IT department, which is greatly needed. And I was advised by HR that the item was pulled. And so it never went before the board. And then the next time I hear about this position is a few days ago. So I was puzzled that it was pushed on, and the circumstances are very different now than what they were before.
Yeah, understood. I think the issue was the board was apprised that one of the issues raised in the litigation from the sheriff against the board was the fact that action had not been taken on this item. And, honestly, we were unaware of this request that had come in late 2019. Of course, COVID hit March 2020. And, I think it probably got lost in the shuffle with everybody, is my guess. But anyway, so that was the reason why it was put on this agenda, so that it wasn't an outstanding issue in the litigation. So it could be, at least a decision could be made rather than just having it hang out there. Supervisor Williams, or Under Sheriff Brewster, did you have a comment?
Yeah, thank you, Chair. Under Sheriff Brewster through the board. We definitely need the position. It's just a matter of how that would work now is what I'm saying to the board is very different, because we had a position to add delete. We would have to figure out the cost allocations for the weighted rates between the positions we have, and if we're able to if the sheriff even wants to have a position deleted in another area, to add that is up for discussion. So it's not that we don't want the position. That's an absolute. We absolutely need it, but it's how we go about getting that position.
Okay, understood. Supervisor Williams?
Yeah, I have a few questions. One is, what does it mean, this terminology, that it was pulled? Who would have pulled it? My understanding is the sheriff asked for this position, and somehow it didn't make it to a board agenda. Is that right? Maybe for executive office?
Chair Jurdy, this is CO Angelo. I honestly don't have information on this position. So I would ask our HR director, William Schertz, if he could talk about the evolution of this position, if that's what the board wants. I honestly don't know.
Okay, well, we can move on. I was just trying to understand the fact pattern. And then I guess the next question is, we only have so much budget. The options are either we add more budget to the sheriff's department, cut somewhere else at the same time, or we trade one position for another. Does the sheriff's office have a preference? If you say you need this and you can't cut anything else, we're going to have to cut somewhere else. And I would support that, but I would just want to be clear on, 2 years later, do you still have this need?
I believe I can answer that. Supervisor Williams, through the chair. This came on in such a rapid succession, we would have to take a look at our position allocation table and see if that we do have anything that we could delete. At the time that we brought it forward, it was the perfect time, because it was actually a cost savings, and that dispatcher had been working in the IT department with a lot of the basically getting our dispatch upgrade done with our computer system. Now, we need the position, absolutely. However, until such time that we have time to actually go through our position allocation tables and find something where it could be a cost savings or level, I don't know that I want to jump in on that.
That being the case, and I respect that, is it possible that you could not sue us for denying this position, given that we haven't denied it? And we're here today hearing that we're not sure if we should move forward? Because I feel awkward approving it if I hear maybe it's not a good fit given the current circumstances, but I also don't want to deny it and be sued for denying it. What do you recommend is the best path forward? I think this is an area we don't need to have conflict.
Well, I understand that, but at the same time, I've explained numerous times I am not going to litigate this over Zoom.
I understand, but what do you want us to do? Approve this position today or deny it? And if you tell us to deny it, are we going to get sued for following the advice?
Once again, I'm not going to litigate that today. The fact of the matter is, we need the position. We heard about this just a couple of days ago. I came back to work Monday morning and the undersheriff briefed me on it. We haven't had time to go look over the position allocation tables.
Okay, Supervisor McGordy?
It might be wise to continue this and allow the sheriff and our HR department a chance to take a look at what their position allocations are, and rather than put anyone on the spot right now to make a quick decision. I think more information is needed here to make a wise decision, and that's what.
Yeah, I agree. We did hear County Counsel Christian Curtis say that at the time that this was put on the agenda, it was unknown to the county staff, county HR, county counsel's office anyway, that the position swap option was unavailable. Supervisor Hashak.
No, I just agree with what you and Supervisor McGordy have said, that maybe it's better to hold off on this, let the sheriff and undersheriff work on this a bit and come back with some proposal.
Okay. Any further comments from either Sheriff Kendall or Undersheriff Brewster?
No, thank you for your time.
Okay.
Thank you, Board.
Okay, so this item will come back after the sheriff's office had a chance to, consult with HR department and bring back an item on this. Okay, all right. Well, then that takes us to item 5G, which is, let's see, discussion possible action regarding presentation to the Board of Supervisors from the Behavioral Health Recovery Services to allocate and approve funding in an amount up to $550,000 for mental health transportation and alternate site for COVID-19 pandemic support services. Sponsors, behavioral health.
All right, good afternoon. Dr. Janine Miller with Behavioral Health and Recovery Services. The item before you is related to our COVID surge. As we spoke about earlier this morning, Mendocino County is experiencing a surge in positive COVID cases that are impacting our local emergency rooms. The Adventist Health System did ask the county for support in supporting their hospitals and emergency rooms. And there were two items that they felt would very much support the current surge and their staffing and their hospitals. One was for the county to assist in transportation of individuals on a 5150 hold to local psychiatric health facilities. And the other was to support with being able to have a crisis like support service location so that individuals could be discharged from the emergency room, stay somewhere within a county facility and wait for a placement in a psychiatric facility. As we know, getting a bed at a psychiatric facility is difficult. It's not always easy to do. It can take a couple days to find one. And as we know, with the fires that are in California, it is impacting some areas and definitely will probably impact the availability of psych beds throughout the state of California. So we are asking for the dollars to be able to support both of these efforts of transporting individuals to psychiatric health facilities and also for support with the care site so that we're able to provide 24/7 services for individuals waiting for a bed. The dollars, the $550,000 is a mix of staffing time, so staffing support and contractor support. Redwood Quality Management Company and Redwood Community Services have stepped up to support us in transporting individuals to psychiatric health facilities. So the ambulance will get first right of refusal. If they're not able to transport within 2 hours, then we have agreed that we will come up with another transport option with the local hospitals. That does, we'll go for Redwood Community Services and Redwood Quality Management Company will try to do the transport. If they are not able to, then it will we'll look at county staff to do those transports. That does mean that this is an unpaid service at this time. It is not something we currently contract for. It is something that Medi-Cal and private insurance companies will reimburse an ambulance to do these transports, but will not reimburse us to do these transports. So this is a need that we definitely need, but we'll also need funding to be able to cover these new ways of transporting clients to facilities and also the facility. So we're looking at staffing time both for county staff, contracted staff. We're looking at security, janitorial, and utilities and supplies both at the care site. So we're able to do all that in addition to mileage and gas. We are projecting that we will need to do these services at least through December 31st. Obviously, if we get out of the surge earlier and we're able to rely solely on ambulance again, then we will do that. But we wanted to make sure that we're looking at a potential long-term based on, we'll see what happens with our surge, but we want to make sure we have the services available at least through the end of this COVID surge. So I will, one of the currently Behavioral Health and Recovery Service does not have the ability to fund these positions. They're not billable through Medi-Cal. So, obviously we don't have the additional dollars to cover this service at this time. I will hand it over to Assistant CEO Darcy Antle. I do believe there is the American Rescue Plan Act dollars that may be able to fund this project as an option to cover these costs.
Darcy Antle, Assistant CEO, if I may, through the chair. Dr. Miller is correct. We had looked into the ARPA guidelines, American Rescue Plan Act guidelines. And as this is directly related to COVID and mental health, we can use those funds. So that'd be $550,000 from the American Rescue dollars.
Okay, thank you for that. Supervisor McGordy?
So I've seen the setup. It's very nice. And Dr. Miller and her staff have done a great job. I do have just a question, probably a concern, and that's for everyone's safety. So it's not really a secure facility. So first of all, how do you assess if it's okay for your staff to take somebody there? And then and as far as having patients there, what are kind of your procedures to look after them?
So in regards to verifying, well, we make sure that crisis is looking at every client. We really want to make sure that every client coming in is acceptable for the facility. We are not able to, at this time, house any minors. We don't want to have minors with adults in the same facility. We're not housing anyone that's COVID positive. So every individual coming into the facility will have a COVID test prior. That's actually required before you go to a psych facility. So it's just something we have to do already. They will not take COVID positive as our local, at any of the psych facilities right now. So that's always something we're dealing with. And anyone that needs medical sedation or restraints will not be housed at the facility. So we're really assessing the level of need of the individual. We're making sure they're not an AWOL risk. We're making sure they're not a violent risk. And we're just making sure that it is appropriate for the level of, for the facility and for the staffing level that we have there. We're assessing everyone to make sure they fit, and not every client does. And we'll only be taking those individuals that are able to safely be housed in that facility.
It seems like a very good environment for kind of de-acceleration. They're upset. It just seems like it's a quiet and calm. It's really much better suited than an emergency room to be holding someone waiting transportation to a psych facility.
Okay, thank you. Supervisor Hashak.
Thank you, Chair Jurdy. So is the ARPA funds the only available source of funding this?
Darcy Antle, Assistant CEO. At this time, those are the only bucket of funds that we have available that are not already committed or obligated to another source.
Okay. Do we have any public comment on this agenda item?
There is no public comment on this item.
Move the recommended action.
Second.
Okay, we've got a motion. Can we have a roll call?
Supervisor Hashtag,
Yes.
Chair Jurdy,
Yes.
Supervisor McGorty,
Yes.
Supervisor Mulhern,
Yes.
and Supervisor Williams.
Yes.
The motion carries unanimously.
Okay, thanks. And Dr. Miller, you're up again. Item 5H, discussion and possible action regarding approval of funding request up to $1 million for additional mental health crisis responders to respond to mental health crisis calls for service. Go ahead.
All right, so we are bringing this item forward to the Board of Supervisors for a request of $1 million. We did get some notification that there would be a need for a dual response with our sheriff's office to respond to mental health calls. At this time, we don't have full response teams. Measure DB did agree to fund a couple of teams, and we have started that process, but it is not enough to fund a response throughout our whole community. We definitely don't want our community to go without mental health response, and the way that we need to do that is being able to implement a mobile response that is either dual with our law enforcement, which would be the best option so that we don't have staff going out there alone, or to have mobile crisis going out on their own. We realize that this is probably going to be need to be a full county response, in the sense that we're going to need to be able to respond throughout the whole county for this mobile unit. We are asking for the $1 million to be able to start building those teams. We need to be able to purchase caged vehicles. We'll be able to need to make sure that staffing have phones, signal boosters, and Bluetooth. If they're out somewhere, they're going to need all that. We also know that we'll need to work with our Redwood Community Services, our local crisis contact, to really try to blend this into a county contractor response so that we're able to cover the whole county. So this will be a joint effort between the county and our local contracted provider to be able to roll this out within our community. So that's kind of what the $1 million we're looking at is staffing, cars, and then support services. We have applied for a grant that's around mobile crisis. We don't know if we'll get it. We're hoping it will augment this. We also know there's another grant coming out in October that we can apply for, but it's really focused on children's mobile crisis. So we're going to be looking at that also. We'll also be looking at additional funding sources that may or may not pop up. But at this time, this is not something within the behavioral health budget. This is not something we can fund within our current budget. We will levy whatever we can within the dollars to be able to bill Medi-Cal for what we can, but some of these services are just not Medi-Cal billable, so we won't be able to get a reimbursement, but we will get reimbursement for everything we can. I know that Sheriff Kendall and Under Sheriff Brewster were going to be available if there were any questions regarding the sheriff's office, so I do want to make sure that they are on and available to respond to any questions they may have. They did want to make it clear that they will do a dual response. They did not want to send the mental health workers out alone. And so they wanted to make that very clear to both behavioral health and the board. So I see that they're both on if there's any questions or if they want to add anything.
Would Sheriff Kendall or Under Sheriff Brewster like to add anything?
No, I agree with everything that Dr. Miller brought up. The one dual response person that we have right now has been helping us just incredibly. A lot of the work that's being done is we will respond with mental health and behavioral health to these things to keep them safe, but they have such a greater, more vast amount of knowledge in dealing with these things. We are seeing a marked reduction in transporter 5150s. We're seeing a marked reduction because we're meeting people halfway with the correct tools and the correct training. My deputies are very good at keeping people safe. They are. And we want to respond with these young folks and you know, glean some of their experience while they glean some of ours as well. So far, it's been working well. But with the current staffing levels at the sheriff's office, a lot of these behavioral health problems that we're dealing with once we made a determination, we can't have that deputy tied up for another 3 to 5 hours with a person who's been 5150, or, you know, getting a person to behavioral health in order to get them some services that keep them from going into that 5150 realm. So if we can continue down this road and get good coverage across the county, and not blur or not have any issues with city limit lines, you know, these folks, just because something is occurring in the city doesn't mean that they're not a resident of the county. You know, things happen when people go shopping also. And so I think that we can get somewhere on it. Dr. Miller's got a very good point that, you know, this is kind of also a direction that the entire nation is going, because they understand that these patients deserve a little better than what Joe Average Peace Officer brings. Once in a blue moon, we will have somebody who has a degree in neurosciences or something like that, but that's kind of a fluke. We had a deputy that worked for us for several years who actually had a degree in psychology. And he was very, very helpful. But, you know, he was a deputy sheriff. It was just kind of a strange thing. So we want to support Dr. Miller in this because it's also going to support the sheriff's office. Lord knows we aren't going to let people go out by themselves and get hurt. But it's that after work that comes after the initial call where we're kind of getting bogged down taking care of the business. And if we can get some assistance with that, I think we can keep the deputies on the street a little more and do a little better service.
Okay, thank you. Supervisor Hashak and then Supervisor McGordy.
Thank you, Chair Jurdy. So with the MOPS program that the board approved quite a while ago, that we approved 3 positions, I believe, and we've only been able to staff one of them. I guess my question is, how can we staff these new positions if we can't staff the ones we've already said we wanted to staff? And the second part of that would be, can we use Measure B money for this?
So we are in the process of transferring a staff right now, so we'll have 2 of those positions filled. We also did meet with the Sheriff's Department on Monday to talk about some different ways of advertising. There are a lot of people who want to work in the Sheriff's Department but not be a deputy. So Sheriff Kendall and Under Sheriff Brewster did come up with some alternative ways to help us advertise. We're also going to be reaching out to the local colleges, and we're actually going to open it up to another classification to really see if we can pull additional staffing in. So we're looking at additional ways to really expand what we're doing and be able to pull additional staffing in. As for Measure B, I mean, that's I would refer that to the board to make that decision.
Supervisor McGordy.
This seems to be a good solution for a problem, but you only have 23 working deputies right now. That seems kind of perilously low. Well, is this a case of people being out of commission because they're not well, or is it just low staffing, or what's your situation, Chair?
Through the chair, Supervisor McGordy, it's a combination of both. I believe that we actually have 7 out on injuries right now. Some of them are pretty serious, and I don't expect to see them back. And then we've had a lot of retirements and whatnot. The police academy being closed during COVID and whatnot put everybody kind of behind the 8 ball, because all of a sudden now we're in huge competition with other agencies. Now we've got some good laterals that have been applying with us. One young person just came up and rode with us the other day, and that he's looking like a good lateral deputy. We're also working on a big outreach and a big advertisement right now, hoping to be recruiting more. And then we were going to jump in with Dr. Miller's crew to help recruit for them at the exact same time, because, you know, we're seeing a lot of folks who, you know, want to work for a police department, want to work for a sheriff's office, just don't want to be a deputy or a policeman. And, you know, this is one of those things where we could have kind of the best of both worlds if we jump in together, advertise together, and then continue to work together.
Okay. Supervisor Williams.
So I fully support the item. But my question is about the 23. That also strikes me as unrealistically low. Is it, and I don't doubt the sheriff, but HR, when I had asked months back, I think gave me 96. What is that discrepancy? Is that, are we heavy on admin or?
23 patrol deputies.
Right.
That we actually have working patrol right now. That doesn't count the sergeants and the lieutenants.
Got it. Got it. And how many do you need?
Well, I'd have to sit down with the position allocation table, but
yeah,
we normally run, I think just right just about 40. But we've got, you know, like I said, some of these long-term injuries, and then I believe that we actually had between retirements and severances, 7 or 8 so far this year, or last year and this year. And that came right at that time when the police academies were shut down. And then also attendance in the police academies getting lower and lower and lower.
Right. Right. So if this is an innovative approach of using a different tool and we think it might work better, I'm in favor of it. And I think Dr. Miller's come up with some ideas. But if this is because we don't have adequate staffing and we can't find people to hire, it strikes me that we should ask the state for mutual aid. Any thoughts on that? Is it appropriate?
When we spoke with the state about mutual aid regarding the marijuana issues, there was no funding for it.
Yeah, but marijuana is different than all the other issues at hand. I mean, nobody wants to touch cannabis. It's a disaster.
Yeah. But there's no real funding for mutual aid this year. And that's been a lot of issue. That combined with the fact that every place just a little to the east of us is in the same situation that Mendocino County was in the last couple of years with these fires. That mutual aid is being pulled from all corners of the state to go up into the areas that are having those massive wildfires right now. That combined with the fact that this is not something new to Mendocino County, it's something new to Mendocino County, but it is pretty much the same across the state. Most police agencies have a large vacancy rate right now, huge vacancy rate. Some of them are running into the mid 50%.
Should we ask for mutual aid nonetheless, just to have it on record so the state knows that we're, I don't know, I would say dangerously low on staffing?
Well, I can speak with the OAS regarding that, with state OAS, but I don't know that it will be well accepted when probably every other agency in the state is experiencing the same thing. As a matter of fact, the Highway Patrol, the Department of Fish and Wildlife, all of those agencies seem to be down quite a bit this year.
I think County Council has a hand up for a while.
If I may, Mr. Chair, I just this might be a question for the fiscal team, but since there was the mention of mutual aid from the state, and since this is related to shortages caused by the COVID emergency, you might just want to see if there may be reasons to request aid to be able to preserve a right for reimbursement of some of the costs later on through either the Cal OES or FEMA funds. And I'm not saying that's definitely the case. I don't know those rules well enough. I just know it well enough to flag it, and the fiscal team might be able to speak to that.
Christian, and can you also guide us on, would we, to seek future reimbursement, would we need to declare an emergency, or is an existing declared emergency adequate?
You've already declared an emergency related to COVID.
Darcy Antle, Assistant CEO. Yes, I agree with Christian Curtis. We should ask for aid just to make sure it's on record with the state. So again, I support asking for the aid in case there's any additional reimbursement now or in the future that we can seek.
Okay, sounds like a good suggestion. And for clarification, Supervisor Williams made a reference to HR saying that there were something like 93 positions in the sheriff's office. I assume that must include also the employees of the jail, probably.
It also includes our bailiffs and our part-time personnel. We have a lot of folks in the bailiff's office who are, kind of retired and working those half-time hours, because not all the courts are constantly running. And then we've got a couple of part-time positions, one that is actually working in the marijuana unit, things like that.
Okay, just wanted to clarify that. Okay, so I don't remember, did we ask for any public comment on this agenda item?
There is no public comment on this item.
Okay, thanks.
Chair Jordy.
Go ahead.
Well, I was going to move the recommended action, but I'd like to augment it to include the mutual aid request. Is that appropriate?
Sure, go ahead.
I move the recommended action and direct staff to work with the sheriff to request mutual aid in regard to the low staffing level during a declared emergency.
I'd second that.
Okay, we got a motion. Can we have a roll call?
Okay, Supervisor McGorty,
Yes.
Supervisor Mulhern,
Yes.
Garrity,
Yes.
Supervisor Hashak,
Yes.
and Supervisor Williams.
Yes.
Motion carries unanimously.
Okay, all right, well, thanks. I believe we have no legislative update today, but I guess we do have a CO update.
Chair Jurdy, this is CO Angelo. No, we do not have a CEO report today. I apologize, on the chair script, it says that we do, but we don't. We have no legislative update, no CEO report, but may I ask a clarification on the motion? In order to move the motion from the last item that the board voted in, you voted in an emergency declaration regarding the lack of public safety, if I understood that motion. And so I think it was for the sheriff to go ahead and move that forward. So I just wanted to be clear on that. That is the sheriff going to work through OES to go ahead and send up an emergency declaration for lack of staff and public safety? Or is that something you wanted to work through me as OES director? I just needed clarification so we could move the recommended action forward. Thank you.
Okay, thanks. Sheriff Kendall, can your office submit that request?
Sure, we can submit that.
Okay, right, great. Okay, so that just leaves us to item 6E. Do we have any supervisor reports?
I just wanted to mention that the ad hoc met with Camille of RQMC and Dan of RCS to look at potential outcome data. And I was pleased. They do have data. It's standardized. They walked us through it. We don't have a copy yet, but they're working on getting us a copy that protects private patient confidentiality. And then I think we plan to bring it back to the full board. But I was quite pleased working with them. I think we're going to get something that the public will be able to digest.
Great, thank you. Any other updates? Just very briefly, Mendo Recycle, sometimes known as MSWA, Supervisor Mulhern and I, we have a special board meeting on Thursday, and there's been some recent staff resignation, so we need to we'll be bringing back a recommendation to the board probably in the near future. Any other board reports? Okay, not seeing any. We will adjourn at 5:07.
Oh,
go ahead. Okay.
Atlas Person, Deputy Clerk of the Board. I do believe you still need to announce that item 5E was withdrawn by the department.
Oh, sorry. So 5E was withdrawn by the department. Okay, anything else? I guess not. So 508, we're adjourned.